this hearing. I'd like to also thank my staff for their hard work for us to be here and continue providing the services in our district office. I have Courtney here with me, and of course I have Joshina, thank you, and of course Frank, my deputy chief, and all my staff in my office that are doing amazing work to keep the city moving as well. I would like to recognize that we have been joined by my colleagues, Lynn Schulman, Council Member Brewer, we have Moya and Palladino online, and of course, my colleague De La Rosa. Now we'll turn it over to hear testimony. Before I do that, I'll turn it to the council. Oh, I forgot, my colleagues have a statement. Chair for Health, Lynn Schulman.
Thank you very much. Good afternoon, everyone. I am Councilmember Lynn Schulman, Chair of the New York City Council's Committee on Health. I want to thank Chair Narcisse for inviting me to provide an opening statement for today's hospital committee hearing. Everyone here is committed to strengthening our city's healthcare system, and today we are focusing on the lifeblood of the system, our nurses. Across the country, hospitals are still grappling with staffing shortages and rising workloads, which New York has not been immune to. But we have made meaningful progress, including giving nurses a real seat at the table and shaping staffing plans. This hearing is an opportunity to recognize those gains while also confronting the challenges that remain. Nurses deserve safe workplaces, fair protections, and staffing levels that let them do their jobs without risking burnout. We must remain vigilant about the potential impact of federal budget cuts and Trump's big, beautiful bill, which could jeopardize the progress we've worked so hard to achieve. Many of the partners in this room, our nurses, unions, hospital leaders, advocates, helped guide our 2022 State of Nursing hearing. Your insights then led to real improvements, and your voices today will help shape the next chapter of this work and help ensure that every New Yorker receives the high-quality care they deserve. Thank you.
Now I will turn it over to the council Now I will turn over to the council to administer the oath to the administrator. And Ms. Cineas, right? Thank you.
Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions?
You may begin.
Good afternoon, Chairwoman Narcisse and the members. As Chief Nurse Executive and co-chair of the Equity and Access Council at New York City Health and Hospitals. Thank you for the opportunity to testify today regarding the state of nursing at New York City Health and Hospitals. While Health and Hospitals is only a piece of the broader healthcare system and workforce in our city, we are immensely proud of the impact we make. Our team of about 9,600 nurses is at the core of our mission to provide care to all New Yorkers. Nurses at New York City Health and Hospitals are consistently our first line of defense in our hospitals, clinics, and nursing homes, providing exceptional and empathetic care to our patients. While the American Association of Colleges of Nurses reports that there is still a nationwide and industry-wide shortage of nurses, I'm excited to share updates on how Health and Hospitals has made strides in hiring and retaining nurses despite the challenges healthcare systems face across the country. Regardless of these challenges, we continue to uphold Health and Hospitals' mission to provide uninterrupted care, and are excited to report that the nurse turnover at Health and Hospitals in 2025 is 10.3%, less than the national average of 16.4%, down from 46% in 2019. This has saved the public hospital health system more than $88 million in turnover costs. In 2024, Health and Hospitals hired over 3,400 nurses, replacing temporary nurses, helping save more than $150 million in recruitment costs. Additionally, this effort provides the opportunity for the health system to truly invest in its workforce for the betterment of its patient population. Part of this investment is directly linked to our collective bargaining agreement, which took effect on July 31, 2023, and runs through 2028. With this exciting contract in place, our Nurses for NYC recruitment campaign has provided a roadmap to encourage New Yorkers to apply for jobs throughout the health system. Launched in 2024 and supported by social media advertising, This campaign showcases the wide range of benefits the public health system has for nurses, which includes the nurse residency program, nurse fellowship programs, tuition reimbursement, loan forgiveness, and scholarship programs. In addition to this recruitment effort, we are continuously focused on our efforts to engage the future nurses of New York City. Through a $400 million endowment with CUNY, we have also strengthened our longstanding partnership to expand career pathways for newly graduated nurses entering our public health system. The 5 components of our partnership with Hunter include the preceptorship, student clinical rotation, employment opportunities at New York City Health and Hospitals, quality improvement EBP projects, the student pipeline, and the residency program. Each year, this partnership enables us to recruit from a diverse pipeline of approximately 1,800 CUNY, particularly Hunter nursing graduates, and place them throughout New York City Health and Hospitals. Together, we are establishing an academic practice collaboration that will support joint research, enhance nurse leadership curricula, and promote health equity through shared training led by CUNY faculty and our own nursing leaders. In addition, our current nursing staffing now has access to more than 50 advanced credit-bearing certificate and degree programs across CUNY campuses. Today, New York City Health and Hospitals employs more CUNY-educated nurses than any other health system in New York City. At Health and Hospitals, it is our goal to ensure that staff across the system feel confident, feel prepared to transition from student to professionalism, to professional nurses. Through the nurse residency program, newly graduated nurses automatically participate in a 12-month initiative which offers specialized training, education, and mentorship to support that transition. With the penultimate goal of job retention, this program is structured on essential areas such as ethics, decision-making, clinical leadership, communication, patient safety, and evidence-based practices. Since the launch in 2019, the program has served over 2,000 participants across all 11 acute care sites, as well as post-acute care, Gotham Health, and correctional health services. This investment aims to cultivate a dedicated and skilled clinical workforce as clinicians pursue this career. Additionally, our nursing career clinical ladder program creates a clear pathway for internal advancement, offering outstanding nurses the opportunity to take their careers to the next level by learning. Launched in 2020 and co-developed with the New York State Nurses Association, this program promotes professional development and shared governance and enhances patient care delivery by recognizing nursing expertise through 3 progressive tiers. Participants receive professional coaching through experienced leaders, which validates their skills, boosts engagement, and strengthens professional growth and portfolios. Alongside these clinical-based professional development programs, New York City Health and Hospitals will offer professional advancement opportunities through the Nurse Leader Academy. This academy, launching in early 2026, will be available to both new and experienced nurses. It will provide programming informed by a system-wide needs assessment and national nursing leadership competencies. It will offer intensive workshops to develop systems thinking and prepare nurse leaders for the evolving healthcare environment. The goal of the program is to equip current and future leaders with skills, knowledge, and perspective needed to become transformational leaders throughout their nursing careers at New York City Health and Hospitals. Throughout our nurses' tireless efforts to uphold the value and mission of our healthcare system, we have been honored to see their hard work recognized in various formats. Most recently, in October, 16 of our nurses were recognized at the health system's 4th annual Doctoral Circle of Excellence event, which honors nurses who have earned a Doctor of Nursing Practice, Doctor of Health Administration, Doctor of Philosophy, Doctor of Public Health, or Doctor of Education in Nursing. We have previously honored 146 other nurses at health and hospitals who have reached this level of distinction. Only 2.7% of all registered nurses across the country have a doctoral degree, and we are proud to be part of that representation. Additionally, health and hospitals nurses are recognized through the Daisy Award, an internationally recognized honor for extraordinary patient and resident care. Recipients are nominated and selected by patients, residents, families, and colleagues. In September, we proudly presented 5 of our registered nurses for the Daisy Award, and our Chief Nursing Officer for the post-acute care received the Daisy Lifetime Achievement Award for her dedication to nursing through active mentoring, role modeling, advocating for her patients and residents, and promoting the positive image of nursing. As public service professionals, our awardees continue to prove that our nurses will always provide esteemed care for their patients, no exceptions. As part of our ongoing commitment to fostering a positive and supportive work environment for our nursing workforce, I want to highlight 2 accomplishments that reflect the strength of our nursing culture. This summer, New York City Health and Hospitals Metropolitan became the first healthcare organization worldwide to receive the Pathway to Excellence with Distinction designation, which New York City Health and Hospitals Charter became the United States' first and only long-term care facility to earn Pathway to Excellence with Distinction designation. Recognized by the American Nurses Credentialing Center, this designation recognizes the highest performing pathway organizations around the world and is based on validation from the nursing workforce. I'm pleased to share here with the council that in a survey of 350 nursing professionals, 96% respondents confirmed that Health and Hospitals Charter promotes a culture of excellence in person-centered care and created a positive practice environment. Health and Hospitals continuously aims to deliver high-quality health services with compassion, dignity, and respect to all without exception. It goes without saying that our nurses are an integral part of helping reach this goal, and we are committed to ensuring that they have the tools they need to succeed. Thank you to the committee for the opportunity to testify and for your continued support of Health and Hospitals. I look forward to answering your questions, any questions you may have. Thank you.
First, I have to say thank you for being here, Dr. Sinez, and what you presented. I want to say congratulations for all your accolades.
Thank you.
And much success with that. But having said that, we have some key questions that we want to ask today about the state of nursing in our city. Starting with the shortage that we're having. If I see you doing a lot of progress, you have a lot of nurses being put in the pipeline. I love that because that's something that I was talking about for a long time, the resident nursing. That's all good. Now, the shortage in New York State, if we're looking at ahead, we're gonna be shortened by 40,000 nurses in the state and 4.1 million by 2030. So the numbers you're doing good, but we need to push numbers to make sure that we have enough nurses in the hospital that we serve. Let's share the Comptroller's Office reported that the number of nurses who are full-time equivalent increased by 1,517, or 18% between June 2023 and March 2024. Does this increase cover the nurse staffing needs of New York City Health and Hospital facilities? Or are New York City Health and Hospital facilities struggling to fill vacancies?
Thank you for your question. Yes, the increase covers nursing staffing across New York City Health and Hospitals and all of our needs. New York City Health and Hospitals is not struggling to fill vacancies for RNs.
You're not struggling. So therefore you have enough staff to cover it. Can you provide data on the current number of nurses employed at New York City Health and Hospital facilities? And how many nursing vacancies are you currently facing? What is the current turnover rate?
Thank you. As of November 2025, there are 9,250 nurses at New York City Health and Hospitals. The current vacancy rate is 2%, and the current turnover is 10.3%.
10.3%. Is that a good number?
Yes.
Compared to the statewide?
Correct.
Do you know
Nationally,
the-
it's 16.4%.
16, I think you mentioned it somewhere there.
I did in my opening statement.
I like to repeat things to make sure we are correct. Does New York City Health and Hospital feel that there is not high enough supply of nurses to meet the demands of hospital? If not, why does a shortage continue to persist?
New York City Health and Hospitals, we feel we have enough nurses to meet the demand. We're really proud of the amount of nurses that want to work at New York City Health and Hospitals. In 2024, we hired 3,417 nurses. So nurses really want to work for our system, and we're really proud of that.
So you have enough
Yes.
nurses? The only thing I wish I could have some, because I have some talk about, right? The program in 2018, I think you started, has New York City H&H seen any changes to the rate of nurses reporting anxiety, burnout, depression, or other challenges to their mental and emotional health?
So the data around those diagnoses and symptoms are confidential, but we have seen an increase in terms of the use of our wellness rooms, which we're really proud of. We have 20 wellness rooms across our system, 11 at our acute care sites, 5 within post-acute care, and 4 within Gotham. We've seen over 571,010 visits within our wellness rooms. So that means that the nurses are really utilizing these services that we are providing them to mitigate those issues that you mentioned, such as anxiety, depression, and burnout.
So in that, again, you're doing excellent.
Yes.
Okay. Given the significant cost of living in New York City, as well as the increasing burden of student debt that nursing students face, are there any initiatives run by, which you have some that you already spoke about, New York City Health and Hospital, to help nurses enroll in nurse corps, loan repayment program, or other financial assistance services? Does H&H itself run any similar program internally?
Yes, run by our Chief Learning Officer. We have a plethora of programs that nurses can take advantage of, including what you mentioned. So Nurse Corps, the National Health Service Corps. The federal government also provides student loan forgiveness through the Public Service Loan Forgiveness Program, and our nurses are able to take advantage of that. Most recently, we also launched the Behavioral Health Nursing Career Ladder, where non-nurses can become nurses through a grant, which we have funding for $600,000. And so we're really proud of the 24 non-nurses who are taking advantage of this program to become nurses. So support staff are able to become nurses.
Okay. This question, if you know it, you answer it. If not, you can say no. How much it costs to have a basic bachelor degree in nursing?
I would have to look at the latest stats
Average.
in terms of tuition.
Okay.
Yeah.
No, roughly.
It depends what school you go to.
Let's say you go to a CUNY.
We would have
Roughly, you don't have to be specific.
Yeah, we would have to get back to you on that because tuition has really changed since I was in school. So I don't want to guess.
Okay. Because I will try to see if I can understand based on what you helping, because sometimes I have learned that from a senator. He tell me, somebody can say, I'm taking care of you, give me a penny a day, and a person give me $1,000 a day. And they both can say they're helping me out.
Right.
But
Well,
it's just like I need to be specific on numbers, because numbers don't lie.
Understood. Well, what I can share with you is that for individuals who are taking advantage of our behavioral health career ladder, there's no tuition for them, right? We cover everything. And if a nurse at New York City Health and Hospitals wants to pursue academic development and go to CUNY with their NYSNA tuition reimbursement, they do not have to pay for anything. And we covered that in the last contract.
Okay.
And that includes a doctoral degree, which we're really proud of with our partnership with NYSNA.
Thank you.
You're welcome.
I'm going to go in a workplace culture, because you said how well the folks are looking for help mentally and the burnout, right? That I'm concerned about. Given the many hospital locations and the Gotham Health Center facilities that are run by H&H, right? How do H&H administrators ensure that empathic competent, and respectful people are selected to run each facility, and what mechanisms are available to allow changes to leadership in situations where a manager is acting improperly?
So we're very fortunate to have mission-driven individuals at New York City Health and Hospitals. We ensure that all new employees take modules on bias, cultural competency, communication, LGBTQIA+ health, language access, disability, and effective communication, as I mentioned, and also interreligious awareness. But there's a lot of training for nurse leaders, and there's also annual competencies to ensure that they are leading the right way to ensure that we are promoting healthy work environments for our staff.
Does H&H contract with any travel nurses? And if so, under what circumstances has the reliance on travel, are we relying on travel nurses and decrease, in the years since COVID-19 pandemic? Because I know you rely on a lot of traveler nurses.
So we've done an amazing job. Oh, I'm sorry.
I was just gonna say, how many travel nurses are under contract with H&H as of the most recent headcount?
Thank you. So we've done an amazing job recruiting nurses. In 2024, we recruited over 3,000 nurses.
I saw that.
So we were able to offboard a majority of our agency nurses. So within the model areas of our acute care sites, we only have a little bit over 200 agency nurses right now that are really used to train more of our nurses, and in case a nurse is on medical leave, et cetera, to make sure that we have adequate staffing.
So how many of the travel nurses are using right now?
Over 200, a little bit over 200. In the model area, so that's acute care. I'm sorry.
In what time frame we're talking about? Within a month?
Currently, right now, across our system.
Yeah.
Yeah, and we can get you the information across the enterprise. We can get you detailed information, but we've significantly reduced travelers and temps.
You reduce. Okay. Floating nurses pool, right? Does H&H have a pool of floating nurses who can be called to fill any unanticipated vacancies? Are floating nurses on a different pay structure than nurses in a permanent fixed position?
Yes, we have 73 float nurses across our system who are able to be utilized in med-surg, critical care, and ED, and they are valuable asset of our teams. The nurses are really happy that we now have float nurses. They've expressed joy in having them, and they've been able to really help fill in holes in terms of staffing and overtime needs. And they do get paid $10,000 more than nurses.
$10,000 more.
Yes.
How many floating nurses you said again? Sorry, before I continue the question.
73 active floating nurses currently.
Are floating nurses hired based on the specialty? Or are all floating nurses expected to fill vacancies for any nursing position regardless of specialty?
They are hired based on specialty.
So what are the specialty that we're talking about?
Med-surg, ICU, and emergency department.
How has the floating nurse pool helped to maintain staffing? I think you spoke about it a little bit. Has it improved the workload for nursing to address understaffing concerns?
Absolutely, they have been able to help, yes.
Yeah. Okay. Okay. How do you decide whether to adopt new technologies? Because we talk about technologies, AI, and we were out there talking about it. So how do you decide whether to adopt new technologies, including AI tools, and how do you evaluating their impact on patient safety and nurse workload?
Currently, we have a work group which focuses on hearing the voice of the nurse. So our nurses are integral to deciding what tools we use. And
so let me
Yes.
stop you. The nurses decided which tools,
For nursing,
so you
yeah.
expose them to the tools you do in service and for them to decide.
Well, we're beginning an AI nursing work group right now. And the goal of that is to have the voice of the nurse at the table to talk about their concerns and what can help mitigate those concerns. For example, documentation. So we have a nursing AI work group that we are launching that will be part of the larger steering committee of AI. So it's really important to hear from our nurses in terms of their reservations, where they need help. And so we're collaborating and empowering our nurses to have a voice at the table with AI.
Okay. All joke aside, I don't want no AI or robotic person come to take care of me. The nurses have to decide what is the best things that they can collaborate, which technology that improve patient care, patient health, patient wellness. How is your executive compensation determined in light of planned federal cuts? Will executive compensation be reduced? Because we talk about all the CEOs, COOs, and in the meanwhile, the nurses that actually delivering the care feel like they're not part of the wealth that being distributed over their head. And in the meanwhile, they are struggling.
Right. So our goal is to remain vigilant and understand what is happening and to be adaptive, to adapt as change happens to ensure that we're able to care for our patients.
Okay. How many times has a hospital failed to meet its published staffing ratios in the last year?
That is not data that I have.
You don't have it,
No.
but it's existed, I hope.
Well, there are portals that the nurses who are experiencing inadequate staffing can submit their concerns, and that is reviewed with the nurses and with NISNA at the local level. So there is a conversation and review of all staffing based on the guidelines that are posted on the unit. So there is a review, there is a portal where nurses can share if the needs are unmet.
How many unsafe staffing complaints have been filed by nurses in the last year?
So each site manages that independently within their portals. And protests of assignments are managed locally at health and hospitals with the CNO and with NISNA locally.
Okay, so you don't have a compiled data where we can see how many of the complaint from the head of H&H?
There are individual complaints that are episodic, and there's the portal as well, but that is all managed locally. I do not have a cumulative number.
Okay. I don't know. I'm going to pass it for my colleagues who ask some question, and I'll come right back. I think Chair Schulman. Yeah, thank you.
Thank you. I have an important question for you. So, during the last 9 months, Health and Hospitals Management has been interpreting nurses' sick leave policy differently than they had in the past. For the last 40 years, consecutive sick days used for the same illness were counted as one occurrence. However, H&H is now counting each day as an individual occurrence. This means that nurses could be penalized multiple times for the same illness, such as the flu or COVID. My understanding is the reasoning for it is because there's been an abuse in the system. But my question is, wouldn't it be better to address the abuse than punish everyone with an unfair policy?
We care for our nurses, and we understand that they may be ill, and we want our nurses to use their time when they are ill.
Okay.
And we are actively taking a look at all of our policies.
So I'm going to ask you to please take a look at this in terms of, instead of a sick time counting as 3 different occurrences for the same illness, that it counts as one, and that was the policy. So if you could just take a deep dive into that. I did send a letter to H&H about this week, so please take a look.
Thank you.
Thank you. That's the only question.
And that's the question I was about to ask, because I have a specific complaint. People called me for that. And nurses are concerned. And I can tell you right now, I've been hearing from Kings County, from different Coney Island, different places. And you're a nurse too, so You can understand that. And then there is things that happen when you have families, and then you have one incident, you have little kids, like myself, that have a lot of kids. I had 4, so I had to run around, and then for somebody to tell me one occurrence is just like, I cannot be sick, and then we can be sick too. As a matter of fact, we're exposed to so much. When you have a cold, we don't want to expose our patients. So think about that one. So next, I'm going to pass it. Thank you, Chair. Gail Brewer.
Thank you very much. Years ago, when Roosevelt was Roosevelt, there was housing for nurses. And that's a big challenge for all of us, but particularly for those working in the hospital system. So what is H&H doing about housing for nurses in particular?
Housing has not come up as an active issue, but we will be more than happy to take that back for conversation.
Take it back where? I really feel very strongly about it. It's a huge issue. It makes a difference for people whether they stay here or go elsewhere. So you haven't brought it up? Nobody's brought it up? It doesn't even exist as an issue?
No, majority of the nurses that we recruit are CUNY graduates, and that has not come up in our exit interviews or that has in the recent 9 months, no.
How about child care that is shift related? Sometimes you need more than 9 to 5 or 10 to 6 or 9 to 6. How about child care? No discussion of child care either?
So our nurses are able to do self-scheduling to ensure that we are flexible with their scheduling, and they've really taken advantage of that to ensure that they're available for their shifts. And so we work in collaboration with the nurses for self-scheduling.
Okay, so what I'm also saying though, if you need more nurses, which I assume you do, then housing and childcare would seem to be something that would be on the list, no?
With the
We're trying to recruit more people, right? Is that a fact? We're trying to get more nurses? Yes. Yes?
We have hired over 3,000 nurses, and
Right.
we've done a great job with recruitment. And we allow self-scheduling for flexibility to ensure that the nurses are available for their shifts.
Okay, and what's your retention rate? Do you have that information?
Sure, so our turnover rate is 10.3%, so the difference of that, I would have to do the math.
Okay, but you're saying that you are able to retain for as long as you wish. That's not an issue, retention?
No, our retention rate of our nurse residency program since the inception of the program in 2019 is 87.7%. So we're retaining our new nurses.
Okay. Are there any issues that do come up in the exit interviews from CUNY or Columbia or anybody else that need to be addressed, or are all the exit issues addressed?
Thank you so much for your question. So one thing that came up in the exit interviews were individuals leaving because of proximity to their hospital. And so what we did was ensure that on the internet, nurses are able to see all of the vacancies within all boroughs. So now they're able to apply for jobs because as a new graduate, you may not know the hospitals within Manhattan or the hospitals in Queens or the Bronx. And so we've made a greater transparency for our vacancies on our Nurses for NYC campaign on the internet. And that has really helped nurses understand all of the vacancies within our system. So that's really helped reduce the turnover of nurses leaving because of proximity to where they live.
Okay. So, is it an easy to transfer? In other words, from Metropolitan to Kings or something? Is that hard to do?
That is not hard to do because we have system-wide job fairs where all hospitals are in one room.
Okay. And then finally, what is your, I know you're recruiting and you have lots of good programs that you listed, but what is your vacancy rate?
Our vacancy rate is 2%.
2%?
Yes.
And your retention rate you feel is satisfactory also?
Yes.
Okay. So, I would just offer that I understand what you're saying, but my understanding is there's still a lot of need for more nurses, and we do need to come up with housing and childcare. And I think even though that may not be on your list of exit, I think Dr. Katz would agree with you, having, spent lots of time with him, that those are two issues that should be looked at. Because you can't get childcare necessarily in the middle of the night for a shift. So I just urge you to add those to your list.
Thank you.
All right, thank you.
You done? Yes. Yes. Moving forward, how have you mentored providers, develop policies and procedural changes to address the complaint that we've been talking about, or any complaints in the hospitals?
Can you repeat the question? I'm sorry.
Okay. how have you? What are some coming complaints? Because we want to know what are the complaints and how you're being addressing them. What are the top complaints that you have
From nurses?
from the nurses?
Our top complaints from nurses, I don't want to make things up. I feel that our nurses are really happy with the changes that they've seen over the last few years at health and hospitals. We have over 200 professional governance councils where nurses are empowered to speak up so that we understand what they need. They've talked about things such as documentation issues that we are working on with them within the nursing informatics work group. We are taking a look at transport policies. So it's really a collaborative effort, and we're really proud of the collaboration that we've done. And we see it in our 5 Pathway to Excellence designations where we're fostering positive practice environments. And so we're doing everything we can to listen to our nurses 24/7.
And how you incorporate that in policies and different things to make sure those things are being addressed. It's just like not you talk about it, but there's things in place.
Absolutely. So we have fireside chats, we have town halls where the nurses are able to weigh in on what's working, what's not working, and those are translated into policies, yes.
Okay. Hospitals are supposed to submit actual staffing levels to the State Department of Health. Can you commit to working with the department to publish those actual staffing levels daily for the public on the Department of Health website?
Yes, that is an expectation that all
Hospitals determine what services to close or reduce.
That's an iterative process where we continue to ensure that our patients have the services they need. And so that is an exercise done by the local CEOs, finance and operations. But our goal is to ensure that all patients are able to receive the care they need in our boroughs.
Okay. What service closures are planned in the immediate future? And how many of them are directly linked to the federal cuts?
There are no services planned from my knowledge.
No, none. How do you assess impact on your communities, particularly on patients that may not have other nearby options for care? Do you offer guidance on this?
Yes, so we ensure that we are looking at our community health needs assessments on an ongoing basis, including all of our nurses are able to review the community health needs assessments to ensure that we're doing community work as well as inpatient work. So that's an iterative process.
There has been recent reporting on Black maternal mortality rates in our city and the severity of disparities inflicted on these patients. Yet, the hospital have constantly reduced services across the city. How do you justify this, and what have you done specially to address these issues?
So our goal is to ensure patients have the services they need. We've done a great job in educating all of our nurses within our maternal child health service lines. We're really proud of that work. We've seen an increase of the nurses' competency rates, and we're really proud of the work that we're doing to ensure patient safety related to all patients within maternal child health service lines.
So you're not reducing services on that line?
Not from my knowledge, no.
Now, do by any chance you know that H&H have offshore account investment?
I'm unable to speak to that.
Okay. Because there is an investment, according to some sources, that being done. So the question is, if there is investment offshore, are we going to use some of the investment to provide the care to meet the cuts that coming from this ugly bill? You understand, HR 1?
I understand your question.
Okay, so just relate the questions, and then how we gonna address that. If there's an investment, are we using the profit or some investment line to cover some of the cuts? Some people are interested in that.
Thank you. I can take that back to the corporate team.
What is the average top line? Oh no, you don't know about an investment, so I'm not gonna push on the investment. What is the average top line percent increase in the reimbursement for all services, inpatient and outpatient, bargaining with the 5 largest insurers in New York? Fidelis Care, Health First, Aetna, or former Blue Cross Blue Shield?
Thank you. Because the contracts are constantly being renewed, I would like our finance team to provide you with that information.
How many layoffs are anticipated at your hospital over the next year? Who has job title will be laid off? How does the hospital determine when to institute layoff, and who will be laid off first?
So our goal is that our mission will not, we know that our mission will not change due to these cuts, and we will not back away from serving New York City. We're committed to maintaining stability and safety for our system, for our patients, and for our staff. And the goal will be to ensure that we are providing the best care to our patients.
Okay, let's talk about the active shooter. Some nurses feel like in a modern time, it's not gonna be the last one. We hope it would be never happen, but there was an active shooter incident, right? And outside the emergency department. I know myself in the ER, I'd be probably very concerned about that. It happened at Mount Sinai. Nurses have had testified to the patient safety issues that are endemic to your facilities. Can you outline specific measures you have taken to improve patient and caregiver safety in your facilities in the past year?
Thank you.
How have you created policies ever since?
Thank you. We are committed to ensuring that our facilities are safe for staff and patients. All staff are required to take workplace violence prevention online trainings, which include training on active shooter scenarios specifically. All facilities conduct active shooter training programs, in some places in collaboration with local NYPD precincts. Each facility does a security assessment that is updated annually. Additionally, there's a lot of work taking place right now as it relates to de-escalation training for nurses, for the interdisciplinary work groups to work with physician partners and behavioral health teams. We also recently revised protocols in partnership with hospital police.
Okay. And about at the bedside, are we concerned about that?
Yes. And
Bedside violence against nurses?
Yes, so the nurses take special training, so they take a PMCS training, and they also take a communication training that's 3 hours during orientation. So we make sure at the onset of employment, the nurses have the resources and tools to function on inpatient units. Thank you.
Okay. Oh, I have been joined by my colleagues, CM Mamorato and Gutierrez. Thank you. Okay. Do you, as a nurse, would you feel comfortable declining any intake, like any kind of, like they tell you go to ICU and you're a medical nurse? Can a nurse decline an assignment if they feel like they're not comfortable?
Our nurses are trained to care for specific patient populations, and our nurses are empowered to always speak up if they feel uncomfortable for a patient assignment.
Can they feel comfortable for real to say no and no repercussion, nothing?
Yes, because we ensure that floating happens in specific areas where they have the training. So they are encouraged to speak up, yes. Mm-hmm. And they're also able to submit different documents and escalate to leadership if there's a concern.
Okay, because some nurses feel like they might have repercussion if they come to work and they float them other places that they're not comfortable. So all your nurses is a cross training. So everyone trained for everything.
No, they're trained for specific areas to ensure that they're practicing safely.
Mm-hmm. Okay, I'm almost reaching to let you go because I've been putting you here to ask a lot of questions. Okay, probably my last. Treat to Target program. The most recent Mayor's Management Report described the Treat to Target program, which is a nurse-led chronic disease management program focused on providing intensive support to help primary care patients who are diagnosed with diabetes to reach their blood sugar and their blood pressure goals. What type of feedback have nurses had on administering this program, and has it been successful in prioritizing patients who require more guidance to control their blood sugar? How do nurses get assigned or volunteer to become part of a specialized program such as this Treat to Target initiative?
Thank you for the question. So nurses are hired into the program. We've received positive feedback from nurses who work within this program. They're empowered to work closely with patients to help them manage their chronic conditions, and we've seen success in helping patients reach their target goals. We're proud to share that we have seen over 63,000 completed Treat to Target visits in the last year alone. Thank you.
Thank you so much. I believe you answer my questions.
Thank you so
And I'm
much.
looking forward, as a nurse, what I'm hoping to, I like to hope that you're gonna hold it dear to your heart, once a nurse, always a nurse, and making sure that the nurses are feeling safe, they feeling that their needs are being addressed, and their financial situation too, because it's a calling, but we have to pay the bill. And we know that it's very challenging in New York City. So I'm hoping that because you're a doctor, a nurse doctor, that you're gonna do everything you can, and I'm hoping that the nurses feel comfortable in the environment that they have to work. So I thank you, Dr. Sneers, for being present, and thank you for answering the question. And one more thing I wanna ask you, since I'm gonna have NYSNA coming to testify and some others, I will recommend that you stay with us for a little longer so you can hear the testimony, so you can do your very best to address the needs that we have over our head. Because the nurse is not comfortable, we're all not comfortable, because that's our care. Thank you for your time. The next person I'm going to call is Nancy Higgins, President.
Number 2, the public testimony.
For the public testimony. Oh, yes. This part. Give me a second, Nancy. Okay. I now open the floor to public testimony. Before we begin, I have to lay out some rules. I remind members of the public that this is a formal government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed for the witness table. From the witness table. Further, members of the public may not present audio or video recording as testimony, but may submit transcripts of such recording to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait for your name to be called. Once you have been recognized, you will have 2 minutes to speak, we change it to 3 to give you more time, to speak on today's hearing, oversight topic on the state of nursing. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony of the sergeant to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. When you hear your name, please come up to the witness panel And for that, now I can call the president of NASNA, Nancy Higgins. You're so respectful. I love nurses. Most people clap. They ignore us, but you follow the rules. Thank you. You may begin. Thank you.
Okay. Good afternoon, Madam Chair. Good afternoon, committee. Thank you for having us here. My name is Nancy Higgins, and I've been a nurse at Maimonides Medical Center for over 30 years. And I'm also the president of the New York State Nurses Association, New York's largest union and professional association for registered nurses. And I'm also the co-president of National Nurses United, the largest and fastest growing union for RNs in the country. I'm here to speak about the healthcare crisis that we are facing in our city every day. Nurses are currently waging a battle to defend quality patient care on two fronts. The first front is against the federal Trump administration and its attacks on our most vulnerable patients and on our healthcare funding. The second front is against our city's own private hospitals, which are fighting against all the gains that nurses have made to stabilize the workforce and improve and protect patient care. Nurses have been sounding the alarm for months about the impending federal health care cuts. Medicaid and Affordable Care Act cuts will mean fewer insured patients, higher insurance premium, and less hospital funding. Before these cuts were even passed, we saw the federal administration try to bully our hospitals into cutting care for our trans patient. We saw them bullying immigrant New Yorkers by reversing the long-standing policy of a hospital being a sensitive location, free of ICE enforcement actions. Nurses and our union allies have spoken out against these policies and urge our hospitals to do more to protect our vulnerable patients. As a proud Haitian immigrant, I have seen firsthand the negative health impacts when patients delay care because they are afraid of coming to the hospital. We want ICE out of our hospitals. We cannot carry out a mission of caring for all people unless hospital administrators proactively protect our immigrant patients and have clear policies and procedures for staff to follow. We want our hospitals that have cut gender-affirming care for trans youth and adult patients to follow the New York State civil rights law and protect and restore care for these patients. We want our elected officials to have our backs when it comes to protecting all New Yorkers. And we also want them, including our New York City Council members, to continue to fight alongside us to reverse healthcare cuts and fill the gaps in hospital funding. We know some hospitals will be stretched much more than others. Safety Net Hospital, like Maimonides Medical Center, where I currently work, is under-resourced. New York State recently announced transformation grant aimed at stabilizing the funding for important safety net hospitals like Maimonides. This is an important and necessary step. Our city cannot afford to lose more hospitals or hospital services. We cannot have a healthy and thriving city without providing access quality care for all. And nurses cannot deliver that quality care if our hospital failed to listen to the frontline nurses. Unfortunately, we are facing employers who are all too eager to cut back on safe staffing and nurses' wages and benefits. In our negotiations with Maimonides Medical Center, administrators want to reduce nurse staffing, cancel our shift at will, and make other changes that will harm nurses' retention and patient care. They want to erase decades of benefits that we have won. They have helped us recover nurse staffing levels after the COVID-19 pandemic. And that makes retiree health costs most affordable. Safety nets are trying to reverse the gain nurses have made that have helped our staff safely and deliver quality care for all. We need greater state and city investment in our safety net hospitals, but those hospitals administrators must also be accountable. They must invest in safe patient care in return. The large, wealthy academic medical centers can most afford to weather the federal storm. These are the hospitals whose financial position has recovered from the pandemic and is better than it was 2 years ago, and when we last negotiated our contracts. However, wealthy hospitals like New York Presbyterian wasted no time to cut services and frontline staff, even before the federal health care were passed. Wealthy hospitals like Mount Sinai waste no time in rolling out a virtual nurse and an ambient listening from artificial intelligence. They are investing untold millions of dollars to replace real nurses with artificial caring. And one of the main advantages they cite is being able to bill the patients more. Yet, they have continuously failed to address nurses' workplace safety concern. We were very fortunate that the active shooter incident at Mount Sinai last week did not end in even more tragedy. The hospital was unprepared. I spent some time with our Mount Sinai members that day after the shooting. They were shaken, they were angry because management didn't do anything to help them. And we know that the nurses deserve better, and all nurses and patients deserve better, to work and care in a safe environment. Wealthy hospitals like Montefiore in the Bronx are investing in major expansion, mergers and acquisition of hospitals upstate, all while squeezing their patients in the Bronx in the hallways and reducing healthcare services here in the city. These wealthy hospitals continue to prioritize their profits over our patients. New York hospital prices are already some of the highest in the nation and growing fast. These high costs are not being reinvested back into patient care. People are already struggling to afford to live in New York City. We know they will struggle to afford health care because of federal cuts. New York City hospitals should not make it harder on our patients. They should not take the advantage of the federal chaos and callousness to increase their profits at the expense of our patients. NISNA contract campaign is about 20,000 nurses and 12 private sector hospitals. We care for New York. We are trying to protect patient quality care in every zip code and every borough in this city and all of our 12 hospitals, from the safety net hospital to the large academic medical centers. When I became a nurse, I became a patient advocate. Now we are calling on our allies to advocate alongside for enough nurses and hospital resources to care for all New Yorkers who needs us. This is such a critical time for the health of our city. We need to show New York and the country who we are. We value and we are willing to defend. Thank you.
Thank you so much for your testimony. And like we said, the nurses' work is not about the nurses, it's about the care for New Yorkers, because we're willing to put our lives at risk. That's what we said all the time. So I'm happy to have you to advocate to make sure New York City is a healthy city. So thank you for your work. I want to talk to you about the debt, because I think from administration I was talking about the money part, because we know after you finish school you owe so much, right? Are there nurses that are enrolled in loan repayment programs, such as the National Health Service Corp loan repayment program or the Nurses Across New York loan repayment program? Does NASNA have experts who are able to provide guidance to nurses who are seeking financial assistance for their student debt or other needs?
I know the loan repayment program is based on where you work. I believe if you work in the health H&H, and you may be able to the health repayment program, like someone like myself who works in a private institution, that was not something that we could take advantage of. That's not for us. It's more for, it all depends where you work as a nurse.
So not only the nurses that burn out in a hospital, they burn out in the financial part.
Yes. And
Okay.
I know a young lady, speaking of which, she was trying to go to NYU to do an accelerated program. She was talking to me, and by the time she did the count in 15 months, it's $150,000.
That's a lot of money.
Yes.
When it comes to workplace culture, much of the atmosphere in a workplace is reliant on competent and empathetic leadership. Are there ways for nurses to report good or bad management practices to the administrators of a hospital or hospital system? We know we report good things too. So how do we do that, good or bad?
I don't view it as good at all, because, we'll give you an example that we have a hotline that if something is going on, you need to report it. They so-called a whistleblower policy, but there's no such policy. You go to work one day, something is going on, you view a practice. Even when you call your management, and it's either you get yelled at or they'll say to you, you do the best that you can. And there's not a process where I would say, as a nurse over 35 years, that I could see that we being empathetic or anyone is listening to us. I'll give you an example. Look what happened at Mount Sinai last week. And you would think management would come there and provide services for the patients, for the nurses who were very shaken. Because as a nurse, you work in the most vulnerable patients. That active shooter, anything not only could have happened to the nurses and the patients as well who were stagnant. And there was no one. And the nurses said to me what they were told by the CEO, if you have a problem, call your manager. And they had a chaplain. And as nice now, as a family, we united. We went there, we wanted our siblings, our colleagues to feel that we're here, we understand you. Because as a nurse, when you go to work now in this city, it's become one of those most dangerous situations you could be, because there is no safety or any resource being provided to us.
Thank you. Now, since you are a nurse, and now I can ask you for the nurses that's on the floor, right? Do they feel comfortable declining to take an optional overtime shift if the workplace is understaffed?
If you're working understaffed, if you work on a med-surg unit, I'll give you an example. You came in, you were supposed to have 5 patients. Now you have 10 or 8, someone calling out. And in the next shift, by the time you're ready to go home, you mentally and physically demoralize. So then how do you expect that person to come the next day to take an extra shift? And it's not safe. It's not safe patient care. And what the hospitals need to do is to hire more nurses so we could provide better care.
Do those things happen often?
Yes.
If I have to ask you, how often you hear that? How often that happen in a hospital setting?
Almost every day that I'll get a phone call, even when I'm off, and say, you know what, we came in today, then we only have 3 nurses instead of 5, And then at the end of the shift, there's a phone call. Would you like to stay an extra 4 hours? Would you like to stay an extra 3 hours? And then it's very difficult to provide care to the patients.
On my time, it was not that often. I can tell you that much. Except
Well, it
if there's a
hasn't changed.
snowstorm, things like that, then you have to push another 4 hours. NASNA website include a statement on the practice of retaining floating nurses who can be called open to fill sudden or unanticipated fluctuation in staffing. Does NASNA represent individuals who are considered floating nurses? If so, what kind of feedback have you received from floating nurses about their assignment?
Well, in our contracts, you could either be a float nurse, or you could either do a med-surg nurse or critical care nurse. And like I said to people, a nurse is not a nurse. If you're a nurse, if you needed brain surgery, you would not go to an orthopedic surgeon. So if you're a med-surg nurse, you should not be expected to work in a critical care area. And, vice versa. No, a nurse is not a nurse. I'm an adult critical care nurse. If you ask me to go work in a pediatric, I would not be a service to that patient. It would not be a service to myself. A nurse is not a nurse. So what we say, a nurse needs to work in their particular areas and expertise, and that's how you would deliver safe, proper patient care. I mean, management try it all the time, I'll give you a little in-service for an hour or so, and then that's when we come in as a nurse. You need to stand up and fill out a protest of assignment, and also, you should not be working in a situation where you're not only going to compromise the life of a patient, you're also going to compromise you and your livelihood as well.
It's difficult because I know I would not be comfortable from ICU to go to, from med-surg to go to WeQ and just coming and think it's okay. But unless I have some training to understand it, like for myself, I was going all over. I spent 2 years here, 2 years there, because I wanted to know everything. When you're young, that's what you do. Mm-hmm. But to go there and not having that training, it can be scary. I have some of my colleagues that want to have some questions. Let me pass it on before I continue. I have some more questions for you. Moderator?
Thank you, Chair. So I am from the Bronx, and I will tell you that Montefiore is really working on expanding their hospital in the Bronx at 2 different locations. We just rezoned one area on the Jacoby campus, and then they're looking to expand on the Einstein campus as well, which is very exciting. So it's going to be almost as if there's a new hospital there. So I just want to touch on what NISNA's stance is on nurses that are found to be impaired on the job during their shift. Where do you guys stand with that?
Can you elaborate when you say impaired? Because if I go to work and I didn't take a break, for 5 or 6
substance abuse,
hours,
more of like a
that's
substance
considered
abuse, like impairment. Yeah.
All we know substance abuse, it's an illness. And if your colleague and you witness somebody is impaired, it's up to all of us to make sure that that person not be removed from the situation. We also want to support that nurse or colleagues to treatment program, to different steps, and that's what needs to be done, because mental illness is not taken very serious in this country and this city, and substance abuse, and it's also an illness, and we need to address it the same way. If you had high blood pressure, if you had diabetes, it needs to be treated accordingly.
But would a nurse lose their license if it's, do you have to report it to the state?
Well, usually the employer, report it to the state, and then our goal is not to have any nurse. I'm a nurse myself. No one would want a nurse to go to work while impaired.
Yeah. Okay, so you don't support them maintaining their job then?
Absolutely.
Okay.
After they go to rehabilitations.
I'm sorry.
After rehab, are you able to hear me?
I can't hear that well anyway. Okay. Thank you so much. Thank you, Chair.
No problem. I have a question to follow up that I didn't finish with you with the hospital administration. Do you feel your hospital administration takes your input into account when making decisions that affect the nurses around staffing, closures, or any, difficulty or things that are going on within the structure. I'm going back to Mount Sinai, what just took place. In light of the terrible tragedy that just took place, do you feel that your hospital are taking sufficient measures to address patient safety and, of course, the frontline workers, caregivers? Do you feel like they?
No. It's funny, we had negotiation yesterday and we spoke about hospital safety. The hospital where we have about 20 open, 20 doors, people could get in and out. And what they said to us, we're gonna have security come and explain it to you. And security, when you have an issue, they are nowhere to be found. As far as hospital asking you questions, normally they'll implement something, and then once you find out, sometime from the doctors or from hearsay, and that's when they come back to you and say, well, by the way, what do you think? It's usually after the fact.
How is AI now currently being used in the hospital? Are you concerned for the future of the patients and the nurses?
Absolutely. As we said, every patient deserves a human being. Every patient deserves a human touch. You could have AI to help you with certain things to enhance the care, to monitor somebody's vital sign, but artificial intelligence should not be a way to care for our patients. Human beings deserve a human being to take care of them. First of all, AI is also, culturally biased, and it's not built to address everybody's situation. You have a patient that walked in. Some people could walk around, as an example, with a blood pressure of 150/90. That could be normal for me. For you, you consider hypertensive. So is the machine's gonna say, by the way, Nancy's blood pressure is 150/90. Let's give them some medication. We need somebody to come in and assess the patients. We cannot treat numbers. And artificial intelligence is artificial caring, and we need real human beings. We need nurses who are well-trained to care and assess for our patients.
I'm going to pass it on to my colleagues to ask a question.
Thank you, Chair, and thank you so much, Ms. Higgins. I just want to acknowledge in your testimony and just applaud you for your leadership with wanting ICE out of hospitals. I think I just want to uplift. I too want them out of our hospitals. I too want to remove all barriers for any New Yorker to seek access and care. So that's getting ICE out of our hospitals, Rikers, schools, etc. But thank you so much for your leadership and for your stance on that. I had two questions. One was just going off of what Chair Narcisse asked related to AI. Are you familiar with, I guess, what is the process? Like, I'm the council's tech chair, and a lot of the ways that we are made aware of AI in city government is after the fact, after it's already been piloted, after it's already been used. For you and for your fellow nurses, what is that process like? Are you brought into the fold? Are you part of the conversation? Are there and I agree with you. I think every patient should be met with a human being for all the reasons that you highlighted. But what is that process like? I know in the instances that you highlighted in your testimony, these are in the city's private hospitals where, some of these administrators jumped the gun and, essentially replaced nurses with some of these services. Are there instances where hospital administrators are working with different leadership teams of staff at the hospitals to inform them, like, hey, we're working with an AI company. We think this could be really useful. Are there instances where that happens?
Well, I could, testify in the place where I work, and normally that you would hear a rumor, oh, they're gonna pilot this particular, project. And sometimes, I'll give you an example. A few months ago, they were piloting a machine to read the person's brain pressure in the ICU. And the nurses came in that weekend, and the pharmaceutical company was there and already connected to the patients, but no one knew about it. No one was trained, so they gave me a call, and I went to the hospital and I said, what's going on here? we just piloting this particular reading for intracranial pressure, which is great, but it would have been better if there were conversations, if there was some kind of, protocol. Who's gonna be part of that?
Sure.
What do we do? What if the machine stop working? How do we go back to monitor that patient? As I stated earlier, a lot of time, the hospitals wanna come out with everything with those AI, but we're not part of the decision making. And we need to be part of the decision making because it's affecting how we care for our patients. And we are the one at the bedside delivering care all the time. You bring this machine, it looks great, but what do we do with it? How does it work? Is it gonna work on every patient?
So
What
you
is the
weren't
outcome?
trained? No one was
there was no
trained?
training. So they ended up listening to me and pulled it until we had training and had conversation. But so many times, this is what we have to do.
Right. And this, and unfortunately, it sounds like you have to make that demand with every single new tool, with every single new technology, which is just unfair and even more of a challenge for retaining nurses. Are there instances where nurses are leaving or forced out because of AI technology?
Well, there comes to a time, nurses are leaving the profession, period, because of the way we treat it. If you look at the amount of nurses that are licensed in the state of New York and the amount of nurses that are working, because we are mentally and physically demoralized, we don't have enough staffing. And then a lot of times, my colleagues will say, all they want you to do is click on that computer, in order for them to generate their revenues. And then you're away from the bedside, and then you are expected to do more tasks with less staffing. So nurses are leaving the profession overall, not, for everything, and, our condition of work.
Yeah.
The working condition is not really great.
Yeah.
And that is one of the reasons in our contract campaign, we are putting strong language, and we got to AI. The
Yeah,
AI should not
excellent.
be replacing our nurses. They should not be the one to care for our patients, because we need real nurses at real time at the bedside to care for our patients.
Excellent. Count me in. I'm supportive. And I know the chair is as well. Just one more question. I think about 2 years ago, we had a similar hearing with Chair Narcisse. This was before the bargaining. And there was just as many nurses there then as they are today. And it sounds like in many ways, not a lot has changed. I remember a focal point being care, enough nurses so that you would not be working more than the required shift so that you can care per patient at a safe ratio. Of course, the testimony that we had just 20 minutes ago sounded very different, very positive, very flowery. What can you tell me that you think that we have gotten right in the last 2 years, and where are the areas where we should prioritize? I get it from your testimony. Nurses need to be respected, hands down. We need more nurses. What about the marketing campaign do you think has worked to recruit more? What can we be doing differently? How can we communicate differently? What other languages do we need to include? What are some of those things that you think could be really, really useful?
First, in order to recruit and return nurses, we have to make the working condition better. I started with the safe nurse-patient ratios, and we've had the staffing loss since 2021, and the Department of Health is not doing their jobs. It's a struggle. I was part of that, citywide to have to work with Department of Health in order to make sure that we were compliant with the nurse-to-patient ratios according to the law. We couldn't get anywhere because it was made of nurses and the management side. And I felt, as part of that committee, that the Department of Health, they were not doing their jobs. They were not helping. So right there, we need Department of Health to do their jobs. We need the hospitals to hire and retain more nurses by providing a much better working condition, where you go to work as a nurse, you're able to take your break without having another nurse taking care of your patients while that person have double duty. And when a nurse calls in sick, like we talked earlier, one incident should not be, no one should be penalized for not feeling well and coming to work. And if you come to work and you have a tragedy, you need to be able to take the next day off in order to recover and able to be, because if you're not mentally feeling well, then you can't go to work and deliver for your patients, because I tell your brain is part of your body, it's an organ. It's also need to be looked at and taken care of. That's working in a better condition, able to go home, able to be rested, and also able to make a required living in order to take care of our loved ones and have good medical coverage and proper retiree health.
Thank you. Thank you, Chair.
You're welcome. I know you're very passionate about the profession for nursing. Do you feel the state staffing law is sufficient to address your concerns around staffing? Do you feel that the hospital are transparent about how they set staffing levels and standard in your facilities that you cover?
Well, the safe staffing law, when we first started, it was a beginning, but we need to make it, well, it needs to be national to begin with. But, we're going to focus right now with the state staffing law. It needs to be more, I wouldn't say strict, but it needs to address the situation. It also needs to hold the hospitals accountable. And the hospital where I work at, they're not transparent with the staffing ratios. Then if you go in, there's a sign that, well, today we have 5 nurses on, today you're supposed to have 3 PCTs and everyone else. But if you go around and make round, that staffing is not at the level that it requires to be. And they're not transparent, and it's always, well, someone calling sick. But you're supposed to have enough nurses. If one person calling sick in a department, the whole department should not fall apart. If we have one sick call in the Department of Medicine, it's like the whole place is falling apart because they have to pull from another unit, and that unit is gonna get other patients from the ED. Everything is backward because the staffing level is not up to par. They never prepared the anticipation that, somebody may not feel well tomorrow. Then you need to have enough of nurses to replace off a float pool that could replace a sick call a day. 2 sick call, 1 sick call should not make the whole place on fire. Like they said, oh, this is, staffing shortage, but you cannot have staffing shortage all the time. If you have someone going on a leave, you already know, there need to be, measures in order to replace the nurses.
That's a ripple effects that we're talking about.
Yes, always.
I'll get to it in a minute. What are the risks to patients and public health when hospitals are not appropriately staffed?
Well, as I said, more nurses, better care. So if you come in with a pneumonia and then you prescribe an antibiotic, and then the nurse is working short, instead of me giving you a medication in 1 hour, then it took me 5 hours, then you end up staying longer in the hospital, and it costs the hospital more, and you end up not getting out of bed, be turned in position. Now the patients end up with pneumonia. The patient end up with a bed sore. These are all the effects of short staffing. As a nurse, I want to go to work, I want to be able to provide safe patient care, but it's impossible to ask a nurse to care for 10 patients and say that, everything is going to be addressed, and then a near miss could cost somebody else's life, near miss could cause somebody to stay in the hospital 10 days longer. A near miss could the person end up with a blood pressure, with a bed sore. The person end up with pneumonia. Now the person is more in the hospital, and there's more. It's a ripple effect, like you said. When short staffing does not save lives. Safe staffing saves lives. And we need to have enough staff across the city, in every zip code, in every hospital, in order to care for our patients, in order to make sure that everybody's taken care safely.
Okay. If you have 3 demands right now to improve the nurse's life, what would it be?
Say it again.
3 demands.
3 demands?
To reach us to our destination, a better place for
Staffing,
nurses.
hire more nurses, better condition to retain nurses, provide proper medical coverage for nurses.
Now, I just said 3. You laying it on me.
Staffing is part of it, but
Okay.
you know, I have a cousin who says to me all the time, be careful, because I do home care, and most of my patients who are crippled in beds and cannot get out of bed are retired nurses, because by the time we retire, we're not good to ourselves.
Yeah. For DOHMH. If I ask you, do you have any recommendation for Department of Health? Now, even though it's H&H, but what they can do in that incorporated world that we live in?
Department of Health, do your jobs. Hold the hospital accountable for the staffing language. We need
That's
to
one of
tell
my
them
colleagues'
to do
questions.
their jobs.
What you think they should do?
Do your job.
Do their job. Okay. What can I say, Madam President? I want to say thank you for your time, and I think I have a lot of my colleagues that are going to continue to testify. So thank you so much for your support and for your advocacy, for your leadership, and for your passion and compassion to care. Thank you for your time.
And thank you for having us and giving us this opportunity to testify
Thank you.
today. Thank you.
You see, nurses follow rules. They don't clap, so I appreciate you guys. Thank you, administration that stayed. Dr. Sinez, thank you for your time. Appreciate you. Next is Erin Dupree. Lester Marks from Mother Cabrini Health Foundation. Thank you. You may begin.
Good afternoon. My name is Dr. Erin Dupree of Greater New York Hospital Association, which represents every public and voluntary hospital in New York City. As an OBGYN, I can literally still remember my first days as a resident. Oops. Could you hear me, or should I start over? Could we?
You can start.
Can you restart the clock?
Oh, your time. She said, my time. Can you reset the time? All right. So you got your full time.
We're on.
Thank
Okay.
you.
Good afternoon. My name is Dr. Erin Dupree of Greater New York Hospital Association, which represents every public and voluntary hospital in New York City. As an OBGYN, I can still remember my first days as a resident and what I learned from the nurses on labor and delivery. Who was sick, who was about to deliver. The instincts were amazing. Personally and professionally, I am grateful for the amazing nurses that I've worked with or that have cared for me and my family. The One Big Beautiful Bill Act represents the largest federal healthcare cuts in modern history. The estimated impacts are 1.5 million New Yorkers projected to lose health insurance coverage, $8 billion total revenue loss to New York hospitals, which represents 7% of hospitals' total operating revenue. And what are the consequences of that? Nearly 60% of hospitals already had negative operating margins in 2023. About 30 New York City hospitals rely on subsidies to stay open. This puts 34,000 hospital jobs at risk statewide. Financially fragile hospitals could close or reduce services, which affects all patients. Despite financial challenges, hospitals continue to collaborate to strengthen care delivery and the working conditions for staff. One of those examples is through the New York State Hospital Clinical Staffing Committee law enacted in 2021. It was a result of collaboration between Greater New York Hospital Association 1199, NISNA, CWA, and others. It requires hospitals to form clinical staffing committees equally represented by management and frontline staff. The committees design staffing plans based on patient acuity and other local needs. Greater New York has met with NISNA to share best practices and strengthen working relationships, which has actually led to our joint focus on workplace violence prevention. The Workplace Violence Prevention Bill was developed with emergency physicians, the unions, and legislators. It requires hospitals and nursing homes to conduct annual risk assessments and prevention plans and maintain at least one law enforcement or security officer in emergency departments, with some limited exceptions. And importantly, ensure the active involvement of frontline staff in the assessment and planning of workplace violence prevention. It's passed both the Assembly and the Senate, and Greater New York urges the governor's signature. There are many workforce challenges. Hospitals prioritize staffing needs, but the chronic staffing challenges, especially among the safety nets, do persist. To expand recruitment and improve retention, hospitals do offer competitive compensation and benefits, flexible scheduling, mentoring programs, nurse residency programs, on and on. They're working to reduce or eliminate mandatory overtime, and they build partnerships with nursing schools and community organizations to build those pipelines of talent. Hospitals are exploring how to leverage new technology so nurses can actually focus on patient care, looking patients in the eye instead of doing data entry and documentation, right? We support various programs and development initiatives that fund nurse residency programs, loan forgiveness, and tuition incentives, and we appreciate the New York City-funded nurse residency programs through the New York Alliance for Careers in Healthcare. Hospitals maintain good faith negotiations. However, the current fiscal environment can't be ignored, with the state budget uncertainty and rising wages threatening financially fragile hospitals. Without targeted support, wage competition could deepen the workforce shortages in the safety net institutions. Thank you for the opportunity to testify. Greater New York and our member hospitals remain committed to protecting and supporting the healthcare workforce, especially nurses. Thank you.
Thank you. You see, because of for the noise, I give you extra time too.
Thank you.
Yeah, thanks.
Good afternoon, Chair and members of the committee. My name is Lester Marks. I'm Vice President, Strategy and Impact at Mother Cabrini Health Foundation. Our mission is to provide grants to improve the health and well-being of vulnerable New Yorkers, bolster the health outcomes of diverse communities, eliminate barriers to care, and bridge gaps in health services. In 2024, the Mother Cabrini Health Foundation partnered with the Center for Health Workforce Studies at SUNY Albany to conduct a mixed method study of New York State hospitals to better understand the issues related to persistent RN recruitment and retention challenges. As you can imagine, the report found major factors that contribute to persistent shortages, including challenges with new RN preparedness, unsupportive work environments, workplace violence, burnout, experience gap, and generational differences. As a result of this report and our ongoing research, in May of 2025, the Mother Cabrini Health Foundation launched a $51 million investment to empower nursing professionals across New York State. The goal is to help reduce burnout, address workforce shortages, and improve patient care in 13 New York State hospitals serving high-need populations. This was the first of its kind investment from the foundation and really focused on safety net hospitals that serve the most vulnerable at-risk populations. It will help hospitals achieve industry-leading frameworks in nursing excellence, establish innovative programs to support frontline nurses, and help recent nurse graduates transition into the profession. Each hospital received somewhere between $1 and $5 million over 5 years to pursue either magnet recognition or pathways to excellence, or also help to establish or grow nurse residency and virtual nursing program. We are excited about this initiative, and while it's in its early stages and early months, we look forward to learning with the hospitals who we were able to fund through this program with, and share with the entire field what we've learned, what the hospitals have learned, and work to expand knowledge to ultimately improve patient care throughout New York State. So we thank you for your time today and attention on this important issue.
First, I have to say thank you for the work that you're doing. Are you partnering with NISNA by any chance?
We have not partnered with NISR on this specific one, but we certainly have, I think been in touch through the years, and certainly would love to, have conversations.
I think that's how you started, by NISNA. This is the union that come out there for the nurses. So I would love to see that partnership, explore it, because they really have concern, and you kind of answer to their concerns. That's in right. That. So I want to say thank you.
Thank you, and we've partnered with Greater New York and also partnered with Haney's on this as well to help kind of provide hospitals with the support throughout the state. So
thank you. I appreciate the work. This is great work. And Erin, I have to say thank you for all the recommendation and all the things that we need to do. I'm so appreciative, and thank you for the partnership with those that can actually make sure that New York City health is being addressed. I appreciate your time. Since I will have questions, but if I do have follow-up with you, because since we're short in time, I see so many papers around me, and I want to say thank you for your time. And I'm gonna read this again to make sure if I have any question, I can follow up as well. But thank you for your work.
Thank you very much.
Appreciate it. The next panel is Alicia McMyers from H&H Hospital, New York State Nurses Association, Janara Delon Elorian, Montefiore Bronx Hospital, New York State Nurses Association, Shehu Calafil, Montefiore Bronx, New York State Nurses Association. You may begin.
Hi, my name is Alicia McMyers. I currently sit on the board of directors as the Southern Regional Director. I've been a nurse for over 33 years, and I currently work at Harlem Hospital. Madam Chair, thank you. I just want to say thank you for your support. You reached out to us, and we came to you during the summertime for our reinterpretation of the sick call, and I'm sad that Madam Brewer and Assemblywoman Schulman left before we could say thank you for their support. It means a lot, and we need H&H to say that 3 or more occurrences still equals 1. Anyway, like I said, I want to thank the City Council for giving us an opportunity to share our thoughts and concerns about the state of nursing in New York City. As the Vice President of the local bargaining unit at Harlem Hospital, nurses bring a number of issues and concerns to me. One of the foremost is being staffing. Everyone knows our staffing numbers were decimated post-pandemic, and while there have been mass hirings, especially at health and hospitals, and you heard the numbers and the mayorals, there are times when it's still simply not enough. The acuity of patients are higher, they're coming in sicker. On paper, our staffing numbers look sufficient. However, that acuity is not taken into account. And say if I'm a nurse on a med-surg unit, and the staffing is supposed to be 1 to 6, and my colleague is overwhelmed, burnt out, stressed, and she didn't come into work today, I have to now share that with someone else. That's 1 to 9. And if someone else is going on break, that could be anywhere from 1 to 15 or 18 patients. So by the end of my shift, I'm also stressed. So it's like we're tackling more patients because there is so much more that we have to do for our patients. And we work with ancillary staff, but if they're floated someplace else, you have to pick up those duties as well. Nurses are experiencing extreme stress and burnout. because we care for these patients. We want to give them our best, but we need the resources to do so. Like I said, H&H has made great efforts to hire more nurses, but they can't retain them. I sit on my Recruitment and Retention and Recognition Council. We've had 18 hiring events just for Harlem Hospital alone, hiring over 60 nurses, but half of them did not stay because they're burnt out, they're stressed, and they're overwhelmed. And we know sometimes they also come to Harlem, or H&H specifically, to get their experience, because the private hospitals tell them, oh no, we can't take you, but if you go over to the public hospitals, get your experience in 6 months to a year, we'll be more than happy to take you. They leave work for other facilities with higher pay, where they feel safer and better respected. So we find ourselves on a never-ending hamster wheel, and I'm sure that's everywhere. But I hope we continue to work with the city and the state to ensure safe staffing in every hospital. And I just want to say, and I know my time is up, DOH is surveying hospitals. So I know that our chief nurse said that she's unfamiliar with that, but I know Harlem Hospital was surveyed because of the protest of assignments and the Department of Health complaints.
Thank you.
Thank you.
Be here. Next.
Good evening. My name is Shaiju Kalatul, and I've been a nurse at Montefiore since 2013. I work as a case manager on a med-surg floor at the Montefiore Moses campus. And like so many of my colleagues, I came into this profession believing that patients deserve very best care. But every single day, we are being deprived of resources we need to give them that care. What we need is very simple: safe staffing. Our patients deserve full attention, our full commitment, and our full care. But instead, we are constantly asked to stretch ourselves thinner and thinner. And let's be honest, that's not just hard on us nurses, but it is unsafe for the very people that we serve. One of the things that frustrates me the most about the healthcare today is how often patients get reduced to numbers on a screen. Management talks in systems, acuity tools, data points, and numbers. But when we are at the bedside, we don't see these numbers. We see human beings. We are thinking about the mother who are scared, the elder who is confused, and the patients whose condition can change in a heartbeat. And when that happens, nurses step up. We reassign and we reorganize, and we get things done. But it should not be the way it should be. It can be done better. We shouldn't be forced to make up because management refused to staff us properly. I'm tired of hearing the phrases like, when staffing allows. Because let's be honest, staffing never allows. Not the way things are right now. That's why we are demanding patient-centered safe staffing ratios. That's not a luxury. That's not an unrealistic ask. That's just basic, common sense patient care. When one patient is in crisis, we need to be there. But we cannot do that at the expense of the other patients. Everybody deserves the same. We are fighting for safer staffing ratios that recognizes when a nurse is caring for the sickest patient on the floor. Because if we are assigned to a very sick patient, we have less time for everyone else. And we are forced into a level of care that nurses, many of us feel inadequate, frustrated, and morally distressed. We know, and management knows as well, that when we follow patient-centered staffing ratios, nurses can deliver safe, higher quality care exactly when the patient needs the most. So today, we are calling on Montefiore to do the right thing for your nurses and for your patients and for the Bronx. Invest in safe staffing. Invest in the people who keep this hospital running. Because when nurses are safe, patients are safe.
Thank you. Thanks.
Good afternoon, council members. My name is Janara Dillon-Florian. I'm a nurse at Montefiore Medical Center in the Bronx. I've been a nurse for 17 years, currently working as a nurse practitioner in an outpatient neurosurgery clinic. I'm here today because the safety of our community depends on the decisions made in this room. I grew up in the Bronx, and the best part of my job is being able to care for the patients in my community, because any of those patients can be considered to be my mom, my dad, anyone. I can relate to them, and they can relate to me. Our patients in the Bronx are more vulnerable than ever. Many of them are undocumented. Recently, there was a patient in our hospital who was in ICE custody. ICE agents were inside the hospital. He received surgery. He needed surgery, but they didn't allow him to receive proper post-operative care. They immediately took him after surgery and into the detention center. ICE should never be allowed to interfere with patient care. Every patient deserves safe and proper care regardless of immigration status, because health care is a human right. I'm concerned that Montefiore isn't doing enough to keep our patients safe, and I'm concerned that Montefiore isn't investing in our Bronx community. Meanwhile, Montefiore is investing upstate, including a $750 million expansion at White Plains Hospital, and is exploring affiliation with 2 more upstate hospitals. But here in the Bronx, we're still experiencing overcrowding in our hospital's emergency room. Overcrowding is a symptom of a system stretched beyond capacity. On the units, there are patients placed in hallways where they have no privacy, inadequate bathroom access, inadequate access to life-saving measures. 3 years ago, Montefiore nurses went on strike, and we won the ability to hold our employer accountable for unsafe staffing. Since then, we have hired a lot more nurses, but there are still staffing shortages challenges. Hospital management will say that they can't afford to invest in the Bronx because of the federal health care cuts. But I don't think Montefiore can say they don't have the money to support the staffing and nursing needs of the hospital when they paid their CEO, Philip Oswald, $16.4 million in total compensation in 2023. So just to put that in context, that $16.4 million is more than $1.3 million per month, over $300,000 per week, and almost $44,000 per day. Meanwhile, the median household income in the Bronx was $49,000 in 2023. If Montefiore can afford to pay their CEO as much money every day as many Bronx families earn in 1 year, if they can afford to invest $750 million in White Plains, then they can afford to invest in safe patient care for the Bronx. We need an end to overcrowding in our emergency room. We need to make sure that every patient can get care in a hospital room with a qualified nurse at their bedside. When they invest in the safety, dignity, and humanity, we save lives and our communities are safer. Thank you for your time, your leadership, and your commitment to building a safer, stronger community.
Thank you. Do you, as a nurse, feel comfortable declining to take an optional overtime shift if your workplace is understaffed? Any one of you can answer. Feel comfortable? It seems like I'm giving you difficulty. All right. Do you feel that your hospital are transparent about how they set staffing levels and standard in your facility? Anyone can answer. Don't be shy. You was talking to me.
We do have the opportunity to have the discussion with the management, but they are not forthcoming with the truth all the time. Most of the time, we are left with dealing with the after-the-fact issues. They come up with the situations and they plan it in their C-suite, and then they come up with the decisions. So we are not really getting a chance to get part with their decisions.
In other way, you don't feel like your complaint or whatever the issues that if you ventilate it, they're not going to put weight to it to address it.
Correct. We don't.
You don't feel comfortable to do it. I'm sure NASNA leadership is listening, right? All right. So I want to say thank you. I don't want to put you more on the spot. So I want to say I appreciate you and I hear you. And we're going to do whatever. We are nurses here. We hear you. We're listening to you. And we're going to work collaboratively together to address the issues that we face in our hospitals. Thank you.
Thank you.
Thank you. Next is Alanderzia Jones from Bronx Care, New York State Nurses Association. Tammy Steele, Bronx Care, New York State Nurses Association. Tracy Kavanaugh, Flushing Hospital, New York State Nurses Association. Michelle Jones, Flushing Hospital, New York State Nurses Association. Arena Moma, Interfaith Medical Center, New York State Nurses Association. How many chairs we have? It's 5. We need one more? We need one more chair. One more chair. Yeah. Yeah. You can put a net. Can you put an extra chair? Can you? They can move it around. Or you're gonna feel too squeezed. Get in, sir. Get in. Get in. Get in. It's too much to add another chair? Add another chair for me, please. Ari Moma, Michelle Jones, Tracy Kavanaugh, Tommy Steele, Alanderzia Jones. Oh, she's not. Oh, in the restroom. So you can put a chair when she comes. You will tell her to come back. You can put the one chair. Oh, you have it. Okay, thanks. All right, you may begin.
Good afternoon, Council member, and your colleagues on the panel for entertaining us. Well, okay. Yeah, okay. Good afternoon. My name is Ari Moma. I'm a member of New York State Nurses Association and also a psych nurse at Interfaith Medical Center, where I have worked for over 27 years. I'd like to thank the City Council for holding this hearing today and for listening to frontline nurses. The hardest part of being a nurse is short staffing. We do our very best, but when there are two nurses at bedsides, our patients don't get the care they deserve. And we've always said that all patients are VIP, and they have to be treated like VIP, like human being. I said this not only as a nurse, but as a family member who had a story, a sad story of short staffing. And I'm just going to be a little bit brief about it. About 3 years ago, when my mother was sick, took her to the hospital, and she went for a procedure. By the time she came back from the procedure, prior to going over there, she's supposed to have oxygen, and when she came back on the unit, by the transporter that brought my mother back there, the oxygen was not hooked up on her. And the nurse that was supposed to be taking care of my mom was busy with other patients. So probably my mother was the 20th patient, which care he did not get time to get to my mom. By the time my brother came down over there, my mother was brain dead because he had no oxygen. And if we had appropriate nursing staff, if safe staffing was provided in the hospital, probably my mother would have still be alive or wouldn't have died the way she died, suffering without oxygen. So this is the essence of safe staffing. It affects everybody, every walks of life, whether you're a nurse, you're a doctor, or anything. So So if proper staffing has been placed, like I said, my mother would have still been alive. Unsafe staffing costs life, which has cost my mother's life. And interfaith, one of our biggest issue is when we have a high turnover among our nurses. Nurses don't stay on the job when they are always working hard or working short staff. And the hospital is spending so much money in getting the AI. These are the money that should have been invested in having nurses. We had a meeting the other day. All money are being invested in AI. So we need to put money where our nurses are. Not only the nurses, or the nursing staff, the PCT, everybody, because as a whole, we can work together. Thank you. I think my time is there, but let me stay short on this. But the most important thing, like I said, is the short staffing, and we have to really, look into it because it affects every walks of life, and I'm a living example of who it has affected. Thank you.
And I'm so sorry for your loss. May she rest in peace, but continue advocating is very important. And from my district, I know you're an advocate. You advocate. So thank you for your time to continue pushing for nursing. I mean, the nurses need you. Thanks. And I want to acknowledge my colleagues, Chair and Books Powers Online. Thank you. Ms. Steele?
Good afternoon. My name is Tammy Steele. I am a proud member of the New York State Nursing Association and a nurse at Bronx Care Hospital System. I've been a nurse for 28 years, and I've worked in the medical ICU for 24. Bronx Care is a safety net hospital right there on Grand Concourse in the Bronx. That means we care for some of the sickest and the most marginalized patients in the city of New York. Our patients come in more sick because they work long hours, because they don't have health care, because they're afraid of being confronted by ICE, because all of these reasons, and also because they don't have child care. So by the time they come to the hospital, they're taking a day off work. They're going to see a doctor. The doctor tells them, you need to come to the hospital. But instead of coming to the hospital, they stay out, they work, they try to get child care for their children. And then when they come to us, they are the walking sick people. They have pneumonia, they have sepsis, they come to ICU sicker than sick. And as a result, me as an ICU nurse and our ICU team, we have to drag them back from the cliff that is death, and that is destruction, and that is long-term illness. And these are the things that happen. Also, our patients are VIP. I don't care if they have a dime or they have a billion. They are VIP, and they should be treated as such. Oftentimes in the ICU, we are assigned 1:1 if the patient is super sick, or even 2 nurses to 1 patient. However, our ratio is 1:2. But the problem is this. If I have to take a patient to a procedure, then that nurse who's covering me now has 3 patients, 3 ICU patients. Management will tell us, well, that's okay. It's only for 30 minutes, but you want that 30 minutes to be your mother, your father, your sister, your brother, someone you love, someone who has heart problems. You want somebody there to look at that and to see it. If we don't catch it, then something's gonna happen. So as a result, many times the nurses tripled up, sometimes quadrupled up, having 4 patients, 4 ICU patients on monitors that you have to care for. And if anything goes wrong, guess who's left holding the bag? The nurse is. That means that ICU is what it is. And a lot of times in ICU, you don't get a break. You have to go outside to turn around and make up your mind because it's too much to do for your patient. When you have to go to the bathroom, when you have to go for a break, you don't get your break, okay? Even with that. But I'm so grateful that you have allowed us to come here and to tell you exactly what we need. And I hope, I pray And I have confidence that you guys are going to fight to get us safe staffing and to maintain safe staffing. Thank you.
Thank you. I'm getting the news that I think there's a timing over our head, so keep it tight for me, please. Don't want to decrease your 3 minutes, but try to make it under if you can.
Thank you. Good afternoon. My name is Michelle Jones. I've been a registered nurse for over 40 years and a nurse practitioner for up to 20 years, working in an outpatient setting at Flushing Hospital. I want to thank the Council for giving us this opportunity today to share our concerns about the state of nursing in New York City. Flushing Hospital is a safety net hospital. As such, access to care for vulnerable communities, including immigrants, the un- and underinsured, is of the utmost concern to the nurses who work there. A nurse's first duty is to care for and to advocate for our patients. Nurses care for all New Yorkers regardless of their immigration status, income or insurance status, race, religion, ability or disability, sexuality or gender identity or expression. Our aim is to ensure there are no closures or decrease in access to services. We want all people who call Flushing home and those beyond to be able to obtain the quality care they deserve. At Flushing, I am witnessing that lack of insurance and the fear of deportation are preventing people from getting the medical care they need. The uninsured are likely not to seek a doctor or forgo needed care during cost. With the barriers created by the lack of insurance or insurance that does not cover the cost of services, patients are seeking care only when major health crisis arises or are utilizing the emergency room for their primary care needs. Federal Medicare cuts will be disastrous and will exacerbate an already tenuous situation. Nurses are doing everything possible to make sure that New York City and New York State fill the gaps left by federal health care cuts. Protecting patients also means holding hospitals accountable and ensuring that they do their part. Nurses are very concerned that the Trump administration executive order overturning the long-standing status of hospitals and healthcare facilities as sensitive locations generally exclude the immigration enforcement will harm our immigrant patients' health by deterring sick people from seeking medical care. We are also concerned this policy will harm public health as untreated illnesses will circulate more widely in our communities if people do not seek the care they need. As a result of these barriers, people are not receiving the preventative care they require to keep them healthy. This includes vaccination, cancer screening, or follow-up care. In addition, patients in the midst of disease process, for example, diabetes, hypertension, or cancer, require a multidisciplinary approach, which can only be obtained in a primary care setting. Unfortunately, too many individuals are forgoing the care they deserve. Health care is a human right. Thank you.
That's right. Next, please.
Good afternoon. Is this on? My name is Tracy Kavanaugh. I also am a proud member of NISNA. I've been a registered nurse for 43 years, and I currently work in the operating room at Flushing Hospital. I'd like to thank the City Council for giving us the opportunity to share our thoughts and concerns about the state of nursing in New York City. Today, I'd like to talk about the access to care in Queens. My colleagues and I are concerned about potential cuts to Medicare and Medicaid, as well as the rise of insurance premiums. Cuts will mean serious financial pressures on safety net hospitals like Flushing. Since early 2000, more than 30 hospitals have closed across the state. In Queens, hospital closures have included St. John's, Mary Immaculate, Peninsula, and Parkway. This was partly the result of the Berger Commission, which aimed to right-size New York's healthcare system by reducing the number of hospital beds. This turned out to be disastrous for New Yorkers. Subsequent studies found that, in fact, Queens was underbedded. In a borough whose population is increasing, we cannot afford any more hospital closures or cuts in services. Frontline nurses know that Medicaid saves lives. As a safety net hospital, any cuts to Medicaid and Medicare will have a profoundly negative impact on Flushing's ability to provide care, and in a worst-case scenario, will affect its ability to operate. On a positive note, there have been many improvements and additions made to the services provided Flushing. We're a designated stroke center with a brand new emergency room and telemetry unit, a new mother-baby unit, and NICU that have been designated as baby-friendly. We have a hospice unit. We provide robotic surgery for patients. There are plans for a new ICU and an inpatient psych unit in 2026. These are all much-needed services that the community requires and deserves. All of this is at risk. What a travesty it would be if cuts to Medicaid and Medicare and the rise in the price of insurance premiums meant that these services were underutilized or eliminated. Flushing Hospital needs to remain in the community and be able to recruit and retain nurses to care for the community.
Thank you, and I think it's you.
Good afternoon.
Good afternoon.
Thank you for having us today. My name is Flandesha Jones, and I've been a nurse for over 40 years, including over 20 years of service at Bronx Care. I'm also a board member of the New York State Nurses Association. Bronx Care, as you've heard from my colleagues, serves as a safety net hospital, providing care to all patients, regardless of immigration status or insurance coverage. Many of our patients are uninsured immigrants who, due to concerns about ICE, delay seeking medical attention until their conditions become critical, often complicating treatment and outcomes. The opportunity to witness patient recovery and encounter former patients within the local community I live is gratifying. However, there is an urgent need for increased resources to safeguard both nurses and patients. Ensuring patients' safe staffing levels remains essential, as inadequate staffing often refers in adverse outcomes for which nurses are disproportionately held responsible. Consistent patient-to-nurse ratios achieved through collective bargaining help mitigate complications related to missed care, such as medical errors, health disparities, and infection. The Bronx is known as a medically underserved community area, with nurses leaving the bedside makes it even harder. Increasing in workplace violence correlate with unsafe staffing ratios, organizational policies, and insufficient resources is on the rise. Nurses regularly face various forms of workplace violence, including physical assaults and verbal threats. For instance, last month I sustained a workplace injury when a patient bit my hand, requiring emergency care, and resulting in a $125 bill from the hospital which I work. Concerns about rising healthcare costs are compounded by the physically demanding and high-risk nature of nursing. Nurses seek assurance of safety both during work hours and upon returning home to their families. We respectfully urge hospitals to provide equitable contracts that support nurses' retention, establish safe working conditions, and offer competitive compensations to maintain high standards of patient care, because all of our patients are VIP. Thank you.
They are VIP. So thank you. Thank you so much, guys. I appreciate your time. Next is Darla Joyner, Mount Sinai Hospital, New York State Nurses Association. Dinesh Vorbs, Mount Sinai Hospital, New York State, NASNA. Goodness, and what is it? What's that word? Ehianako, Mount Sinai Hospital, and NASNA. Irina Verut, Mount Sinai Nurse NASNA. Dahlia Brentford, Wyckoff Heights Medical Center, NASNA. We have all. She make sure she got the jacket on. All right. We're gonna start from this end to go that way.
Hello, good afternoon. My name is Dahlia Branford, and I'm a registered nurse and a member of New York State Nurses Association. I have been a nurse for over 19 years, and I've spent my entire career at Wyckoff Heights Medical Center, which is a safety net hospital in Brooklyn. I would like to say thank you for the City Council for holding this hearing, and for giving NYSNA nurses the opportunity to share our concerns with you today. Our top priority as nurses is to make sure that our patients receive the best possible care. As a pediatric nurse, I know that having a sick child is one of the most stressful things a parent can go through. Helping children get better, making sure they get the quality care that they need, and fulfilling the trust that parents have in us, and finally, seeing that child get better and leave the hospital is one of the best feelings. I love being a pediatric nurse, but I am concerned that my hospital, Wyckoff, doesn't have a plan to make sure that our units are safely staffed so that our patients can get the best care that they need. We need to have enough trained and experienced nurses at the bedside. Right now at my hospital, they're violating our contract by what we call double floating. You're floated to another area, and then in the middle of the shift or somewhere in between, they float you back to your unit because it was left unsafe in the first place. So management does not seem to have very concrete plans of how to staff the unit, rather than to have nurses float back and forth during their shifts. It is impossible to care for a patient properly if you don't know where you're going to be within the next 1 to 2 hours. To double floating or even floating, and when we have to cover breaks, leaves nurses with 12 and 16 patients, depending on the ratio, and that's for at least 3 hours for the day, because I have to cover your shift and you have to cover mine. So for 25% of the shift, a patient is staffed unsafely. As a safety net hospital, we serve vulnerable patient population. And for a pediatric nurse or a nurse that works in the maternal child health care, our Black and brown mothers face a mortality risk that is 5% higher than their white counterparts, and that is not right. We need to be able to take care of these patients properly, and in order for us to do so, we have to be staffed safely. Instead of scheduling enough trained nurses to safely staff each unit, our staffing plan is to float, and that cannot happen. We need management to follow the union contract that we have fought for and won safe staffing, and we need them to follow those guidelines that we have in our contract.
Can you please wrap it up?
Healthcare is also, our own healthcare is also an issue. As my colleague stated earlier, one of my NYSNA staffing, she got a $125 bill from her hospital for an event that happened at work.
Thank you.
Having you pay for your own care is something that's atrocious by the hospital. Thank you so much for having me.
Thank you.
Hi, my name's Starla Joyner. I'm the president at the NYSNA Local Bargaining Unit at Mount Sinai. I'm here because we need to talk about Mount Sinai's unit busting tactics. We're dealing with a boss that instills fear, a boss that divides us, a boss that villainizes us. When we try to exercise our union rights, our boss retaliates against us. This is called union busting. We have to call it out. We have to take a stand, and we must stop it. When nurses from our labor and delivery unit came out on their breaks to advocate for bargaining to take place at our hospital, this is something the hospital tends to avoid because management doesn't want to have a large mass of nurses at bargaining. Those nurses ended up being disciplined. A month later, their disciplines still stand as we fight to get them removed. These nurses are admirable. These nurses still manage to support each other by standing up and taking action. They go to work each day, and they still have a fighting spirit. We're calling on our elected allies to be like them. We should all be like them. We cannot let management divide and conquer. We must all stand together and fight together. We're facing hospital management who has repeatedly tried to fight nurses who are vocal patient advocates and demand safe staffing. We demand a voice on the job. They've been finding ways to chip away at our rights as union members since the last contract and fighting against the things we've worked so hard to achieve, like safe staffing and our strong benefits. At many of our negotiating tables, we've seen little to no progress. Management at Sinai has refused to put forth a single proposal. They discipline nurses for gathering for union meetings. They corner nurses when we try to give updates about bargaining to our coworkers. And they recently disciplined one of our executive committee members for distributing petitions. We are here because we will not let their tactics get in the way of our fight for safe patient care. We are here because patients, nurses, and the community deserve better. No matter where the active shooter incident occurred, do not let them minimize our safety in the workplace, because we deserve better.
Thank you. And I can tell you're a fighter.
Hi, everyone. My name is Goodness Yohanachur. I'm also on the Executive Committee Grievance Co-Chair at Mount Sinai Hospital. I'm here to present on the workplace violence issue and security, lacks of security that we have at Mount Sinai Hospital. Being on the Executive Committee, we have put forth so many meetings with management to tell them that we do not want to be a statistic on the news. We need to make sure that we have security personnel, we have weapons detectors and also metal detectors at every entrance of our hospital because we have multiple entrances. Now, the incident that occurred on last week Thursday is an incident that would have actually taken a drastic tragedy or turn for the worse because it happened at change of shift. And what was also mostly appalling above all is that at Mount Sinai, there was no announcement made at all. People were finding out on the news. Parents, my mom called me, and I really don't like to tell her bad news because it can elevate her blood pressure, but just look at it this way. Reading on the news that your child or your sibling went to work, or your aunt, mom, or father went to work, and maybe you're hearing that they were shot. You know, it is very troubling, but the thing that we find most troubling is that our hospital has, from time and time again, have given us deaf ears on this issue. We currently sent them a proposal on security, on our beefing up our security at the hospital on October 3rd. Guess what? We have not even received one counter on that proposal. So what we're dealing with right now is that the hospital is actually minimizing the occurrence of the incident that happened last week, Thursday. Now, our place of work should be a place where we feel safe to care for our patients and also safe to come to work. So this is the issue that we are dealing with at our facility. And we're begging you to please continue to support us in making this a reality, because if not, we are going to really lose our nurses and we're going to also lose our patients. The other thing I wanted to say is most of our colleagues and our sister brother hospitals are in the middle of bargaining, and this is not something that is only pertinent to Mount Sinai, it's also pertinent to other facilities. If this can happen in New York City, anywhere in the country, it can happen anywhere else. So we're here to present this and also to be proactive. Thank you very much for giving us this platform to bring our issues to your ears. Thank you.
You don't have a communication line, like where they can send news to all the staff? From Mount Sinai, you said.
So they did it when we were on strike, but they didn't do it this time.
All right.
Okay, and just to also say, we had our speak out on November 13th, guess what? We had NYPD in front of there with all the barricades. But guess what? We had this incident, and it's being minimized, which is very appalling. Thank you.
Thank you. Next.
Good afternoon, Madam Chair. My name is Dinesh Forbes, and I've been a nurse at Mount Sinai West for 37 years. I've been a nurse for 43 years, and I'm a part of the NISNA Board Director at Large. At Mount Sinai, I work in the intensive care unit. I care for the sickest patients in the hospital. Every day I work, we go into work, we work harder to maintain them, to give them good care. And in ICU, it's monitoring, it's constant hands-on and being there for your patient. When we don't have enough nurses on the floor, it's even harder, because with the monitoring, you've got to be on top of everything to keep them alive. Every single time the patient, I'm so sorry. Safe staffing is essential for providing safe patient care. But instead of investing in frontline registered nurses, Mount Sinai has routinely understaffed and chosen to spend their dollars elsewhere. NISNA has had to take Mount Sinai to arbitration on several occasions to fight for safe staffing. Mount Sinai has invested untold millions in artificial intelligence technologies, over $100 million in one AI facility alone, and have several investments, software products, and facilities whose economic costs are not publicly disclosed. Nurses are not a part of this discussion and had no input in the creation of the facility. Meanwhile, they have implemented new technologies which directly affect patient care, again, without the input of nurses. Nurses are unaware of management's tactics towards healthcare. The hospital system proudly celebrates Sophia, the latest AI assistant in Mount Sinai's cardiac catheterization lab. Nurses have to check Sophia's work to make sure she hasn't made a mistake. When hospitals try to cut corners like this to save patient care, mistakes are made, biases are magnified, and more work is often created down the line. There is no human touch, conversation of patients, concerns, questions. We know what it's like when you're on the other side of the telephone and you're asking for a person. Do we want Mount Sinai's artificial care, or do we want real human care? We are asking for Mount Sinai to prioritize their patients. We're asking for Mount Sinai to prioritize our safety over the creation of machines and technologies that have little research to back them up. This is not just about this contract's campaign. This is about the future of care in this city, New York City, and what we want healthcare to look like. Without intervention, these hospitals will continue to put profits before patients. When they tried to close Beth Israel, they spent over $70,000 on lobbyists. They have shown time and time again their profit motive is stronger than their care for patients. Legislators here have a choice to demand transparency and accountability. Thank you for your opportunity to present.
Thank you. We want human care.
Good afternoon, Madam Chair and Council Member. My name is Irina Viruet, and I have been a nurse on the Child and Adolescent Psychiatry Unit at Mount Sinai Morningside for about 2.5 years now. Many people don't know that right now, being a nurse is one of the most dangerous professions, and that hospitals are some of the most dangerous workplaces in the country. The risks that come with the job. For example, nurses are often lifting heavy patients, working with dangerous tools, and in close contact with infectious disease. However, nurses are routinely attacked by patients and their loved ones. It's also an issue that it's only getting worse as public services are cut and patients grow more anxious about the rising cost of healthcare. Hospitals have a responsibility to protect nurses and patients, and right now, not enough is being done. I'm passionate about workplace violence because I have experienced it. I'm still suffering the consequences today. I was recently attacked by a patient and injured. I had to call security after the fact, and I had to go back and forth over the phone until they came to the floor, to the unit. My unit is the only psychiatric unit in the hospital with no security on the floor. We don't have behavioral health associates who are trained to help when patients are in crisis. We don't have panic buttons to signal when we are in danger. These are all features in every other hospital I have worked in, public or private sector. They would improve nurse safety and reduce workplace violence. But Mount Sinai, one of the richest hospitals in New York City, does not have these basic safety measures in place. Mount Sinai had if they had more protections in place, I would not be out on workers' comp. It has not been easy financially or mentally. Now I'm facing a difficult choice. Do I follow doctor's orders and stay out longer? Do I watch my bills pile up, knowing I cannot afford to be out of work much longer? Do I go back to my unit where nothing has been done to change how my safety to be improved in any way? I'm not the only nurse who has experienced workplace violence. Nurses on my floor often experience verbal and physical abuse. No one is more unpredictable than adolescents and teens in mental health crisis. These are daily occurrences in our hospital and hospitals across the city. We need our hospital to take action. We are calling on Mount Sinai to protect their nurses because we should not be afraid to come to work. It's time to do more to prevent workplace violence against nurses and allow nurses to come to work with their hearts filled with love for what they do, not fear of getting hurt. Thank you so much for having us here today.
Thank you. It should be joy, by the way, because it's a calling and the love in our hearts to care for the patients. So thank you. That's the truth. The next is Janelle Matthews from Brooklyn Hospital, NASNA. Rihanna Lawton, Brooklyn Hospital, NASNA. Lisa Yeno, Richmond University Medical Center, NASNA. Diane Minette, Richmond University Medical Center, NASNA. Deidre Gilsk, Kingsbrook Medical Center, NASNA. And please keep it short because you see all the sergeant, I had to push this hearing because my president could not wait. And then today they have something else scheduled. Let's try to tidy it up for me, please. Thank you. You can start from this end to the next.
Hi, good afternoon. My name is Rihanna Lawton. I'm a member of the New York State Nurses Association and a nurse at the Brooklyn Hospital Center. This is my 19th year of being a nurse. I now work in nursing education at my hospital. As a nurse educator, my top priority is ensuring that we invest in our nurses and give them proper training and a solid foundation. We have a lot of new nurses who do not stay because they don't feel like they have the training or the support to do their jobs. Nurse retention is a huge issue at our hospital. After COVID-19, many nurses retired or left because they were burnt out and could no longer cope with the lack of resources, inadequate staffing, and hospital management that prioritized metrics over safe staffing. We also struggle to get management to commit to providing enough training for nurses. Management wants to give new critical care nurses only 8 weeks of on-the-floor education, but new ICU nurses should receive at least a minimum of 12 weeks on their home units, and then at least 2 to 4 weeks on any adjacent units that's included in their cluster. These are brand new nurses coming straight out of school who have no concept yet of real-world nursing. Management is not giving them the skill set they need because executives are focused on rushing nurses into their positions as quickly as possible rather than building on competence. That's not safe for patients, and it leads to higher turnover amongst our nurses. Workplace violence is also a major issue for us right now, both in the emergency room and on the units. We have had multiple incidents of workplace violence against our staff members this year, which, by the way, is not a metric that they follow because I couldn't even find data on how many we have. The system we have in place is not working. Hospital security does not respond to our SOS calls or workplace violence codes in a timely manner. Many nurses and other staff members have been out of work because of incidents of violence at the hospital. Nurse educators at the Brooklyn Hospital Center only recently won our union. We are thrilled to be part of NYSNA, and we are bargaining our very first contract. Many of us pay up to $700 a month for medical coverage for ourselves and our families, and I've had to pay hundreds of dollars out of pocket for medications. We hope to join the NYSNA Benefit Fund in our new contract. I'm concerned about any cuts to health care for nurses. Nurses and our families need affordable health care so that we can care for yours. Thank you.
How long it takes hospital police to come up, approximately?
More than 10 minutes. Yeah.
Okay.
Yeah.
Go ahead.
Good afternoon. My name is Janelle Matthews. I'm a member of the NYSNA New York State Nurses Association, and I've been a nurse at the Brooklyn Hospital for the past 15 years. I'm concerned about safe staffing at my hospital. I work on the med-surg unit. A year ago, we were downsized to 10 beds. We're supposed to have 3 nurses and 2 techs on every shift. Far too often, our nurses are floated to another unit, or only 2 nurses are scheduled. On a recent shift, there was only 2 nurses scheduled and 1 tech. The other nurse had to go down to the pharmacy to collect a medication. The tech was on break, so I was the only one left on the floor with 10 patients. It's not safe for 1 nurse to care for 10 patients. I should have a maximum of 5 patients at any time. I was in one room caring for a patient and heard the call bell, but I could not respond to the call bell. I was already taking care of the other patient. It could have been for something minor, like a blanket or ice. It could have been a patient with an aura expecting an impending seizure, needing assistance, or someone at risk for falls. It's not fair for our patients when they don't have a nurse available to care for them. While telling management we need to always have 3 nurses in our unit, especially since we have seen an increase in the acuity of our patients, but our warnings about patient safety fell on deaf ears. It's not safe for nurses when we do not have enough staff or the appropriate staff for the situation. A few weeks ago, we had a patient in our unit who was very violent while experiencing a psychiatric event. With no on-site psychiatric department, it's very difficult to safely care for a patient in that situation. The patient had already assaulted several staff members in the emergency room and in our unit. We requested a hospital security watch because the patient was a danger to herself and to us, but the hospital didn't provide us with the security or the appropriate equipment we needed to maintain safety on the unit. Myself and 3 other staff members unfortunately were hurt in separate incidents. I got hurt when the patient got out of bed and fell onto me. I caught her, but it took 4 of us to get her back into bed safely. I ended up tumbling into the bed with the patient during the process as we got her resettled. A few hours later, she was awake and the whole cycle started again. Nurses are on the front lines of keeping our patients and our community safe, but we can't do that without support from our hospitals. We recently had a homeless patient who came in with a bad wound. The hospital wanted to discharge her even though she had nowhere to go. We can't just discharge our patients onto the street. We advocated to keep the patient until the antibiotic therapy was completed and she had a bed in a homeless shelter and access to the ongoing wound care that she needed. While we work night and day caring for our loved ones, we also need to care for our own families. But here at the Brooklyn Hospital, nurses almost lost their own health insurance. We received a letter from the benefits department saying that our hospital hadn't been paying into our benefits plan and that we were on the verge of losing our health insurance on October 1st. That hit home because my daughter has asthma and she requires follow-ups and maintenance medications. As a safety net hospital like mine, nurses continually struggle for good working conditions so we can have enough nurses to care for some of our most vulnerable patients in the city. We are constantly advocating for the resources to take care of our patients because your zip code should not determine the quality of care that you receive in the richest country and state in the world. Thank you.
Thank you. It's a calling, but not calling to die. That's what you're saying. We need help. Okay? Next.
Hi, my name is Lisa Yeno. I'm a certified critical care nurse, and I've dedicated 31 years to nursing, with the last 26 spent at Richmond University Medical Center on Staten Island. I currently work in the medical intensive care unit and serve on the executive committee of NYSA at my hospital. Growing up on Staten Island has strengthened my commitment to provide the highest quality care to this community. Many of my colleagues share this dedication, with numerous nurses having devoted decades of service to Rumsey. Our hospital serves as a vital safety net hospital for Staten Island, catering to a population from a lower socioeconomic background. For many, traveling to other boroughs for medical care is not an option, making Rumsey an essential part of the community. As you know, Staten Island is the only borough without a Health and Hospital Corporation acute care facility. The funding Rumsey receives from city, state, and federal sources is crucial for our continued operation and our ability to serve underserved populations. These resources enable us to maintain our role as a safety net hospital for those who need care most. Like many hospitals, staffing remains a persistent challenge at Rumsey. Although our administration strives to invest in patient care, financial constraints often limit what can be achieved. Nurses consistently advocate for greater investment in both staffing and security to protect both staff and patients. The reduction in security personnel has coincided with a rise in violence over the past year. Several assaults have occurred in the mental health units and emergency department, including a nurse in the ED who suffered a broken tibia. After federal health care cuts were implemented early this summer, a patient stabbed both a security guard and a nurse in the emergency room. Nursing is undeniably demanding, but it is important not to view nurses as martyrs. Each day we make a conscious choice to serve as nurses. However, we do not choose to work under conditions of understaffing and threats of violence. Despite public perceptions that these challenges are simply part of the job, nurses do not sign up to endure inhumane treatment or physical harm. The profession should not become the cost of personal safety. Retention within nursing will remain a challenge unless working conditions are improved, both at Rumsey and at other hospitals. Nurses and patients alike deserve an environment that is safe and supports healing. In struggling safety net hospitals such as Rumsey, equitable hospital funding is essential for achieving these goals and ensuring the well-being of both caregivers and the community they serve. Thank you so much for your time.
Thank you. Appreciate your time. Thanks.
Sorry, Diane couldn't make it, so my name is Jessin Samuel, and I'll be speaking on her behalf too. My name is Jessin Samuel, and I'm a registered nurse at Richmond University Medical Center in the Psychiatric Emergency Room Department. I was born there in the hospital, and I work there too now. I've been there for 10 years. Staten Island is the only borough in New York City without a public hospital. We are the second hospital in Staten Island. There are only two. Rumsey fills that critical gap. We are a safety net hospital for our community. Located on the North Shore, we are often only accessible option for patients. Within the next closest hospital is 25 to 30 minutes away. Rumsey is a level 1 trauma center and certified stroke center. We provide specialized cardiac services, receive STEMI patients, and regularly save the lives of individuals experiencing heart attacks, major blockages, any other life-threatening problems. The Staten Island community depends on the essential life-saving care we provide, from newborns to seniors and everyone in between. Many of our patients are underinsured and rely on Medicaid, making our role as a safety net provider even more vital. Across New York City, nurse retention has become one of the most pressing healthcare challenges. Many nurses enter acute care to gain critical experience that leave for higher paying roles or less demanding specialties. This turnover affects hospitals citywide, and Rumsey is no exception. Our city does not need more injectors or aesthetics providers. It needs more committed bedside nurses. Caring for patients is essential hospital setting. Strengthening retention is a key to maintaining the stability and the quality of patient care throughout all boroughs. Rumsey is also the only facility on Staten Island that provides psychiatric services, which means if you know the bridges, if something's happening on the halfway of Arizona Bridge, they're coming to Staten Island. And if something's happening on the halfway of Goethals Bridge, they're coming to Staten Island. which significantly increases the complexity and intensity of the care we deliver because we serve the entire borough's psychiatric emergencies. We frequently encounter violent or unpredictable situations that place nurses and medical staff at risk. I personally was bitten by a patient, assaulted by a patient, yet I had to continue providing care. I was fortunate not to face serious long-term consequences, but other nurses have suffered far worse, including cardiac events following assault. Violence against healthcare workers is never acceptable, and stronger protections are urgently needed. Despite these challenges, being a nurse at Rumsey is a labor of love and profound service. This hospital truly feels like a family. Our nursing leadership listens, supports us, and works tirelessly to advocate for the needs of both staff and patient. Today, our greatest need is securing the resources, financial, staffing, and structural that will allow Rumsey to continue providing essential, high-quality care for Staten Island community. Our patients depend on us, and we need the support to keep delivering the life-saving work that they rely on.
How your administration is addressing the violence, because you say it's not only you.
So they didn't. Instead, they just cut more security. Recently, we had a new COO that came in a year ago who used to run urgent cares, who on social media requested security to come to his help. However, for us, he came into our hospital last year and took it upon himself without talking to anyone to cut security, and it's been a big problem for us, and we've had a lot of crises that took place.
I have to send a letter to us. Thank you. That's not acceptable. Anyway, this is not. Before you go, I think you had someone else in your team.
It was Diane. Oh, no.
Deidre Gill? No? She's not. Okay. So thank you for your time. I appreciate it. All right. Russell Pinkster, Maimonides Hospital, NISNA. Beth Luden, New York Presbyterian, NASNA. Sophie Boland, New York Presbyterian, NASNA. Miriam Pagan Colon, New York Presbyterian, 1199.
We wanted to send a letter to the COO.
Yeah, because that.
Thank you. Good evening. My name is Miriam Pagan Colon. I'm a registered nurse, and I have been a proud New York City nurse for 18 years. I'm also a proud 1199 SIU member who represents not only nurses, but a myriad of healthcare workers that participate together in providing patient care. Thank you today to you, Madam Chairman of the Health Council and City Council for the opportunity to speak today. I began my career in a med surgical unit in a hospital in Queens where I currently work, and we are level 1 trauma center, the only one level trauma center in Queens. I currently am a cardiac thoracic ICU nurse. I care for our city throughout the COVID-19 crisis and one of the most painful moments in our history. Nurses showed up then, and we continue to show up every single day. But today, we are facing a crisis that is entirely preventable. Dangerous chronic understaffing. Understaffing is not just a workplace issue. It is a patient safety emergency. It leads directly to poor health outcomes, longer hospital stays, avoidable complications, and incredible mortality. And for nurses, it creates a moral injury when we cannot provide the level of care our patients deserve. That moral injury becomes burnout, and burnout is driving experienced nurses out of the bedside and keeping younger current nurses also from joining the bedside. I am also a Brooklyn resident and a patient in this city, a mother and a daughter. The state of our hospitals and the state of nursing today affects not only the patients that we care for, but it affects our own families. We do have staffing legislation, but without real enforcement, it is nothing more than paperwork. When facilities ignore their own staffing plans and face no consequences, guess who pays the price? Patients pays the price. We are also confronting real and a widespread workplace violence. Nurses are physically and emotionally injured. Not only nurses, but other healthcare workers as well. Yet, many incidents are minimized or dismissed by our institutions. This adds to our stress, deepens our moral injuries, and directly contributes to poor nurse retention. No healthcare worker should fear for their safety while caring for patients. I am here today to urge this committee to hold hospitals accountable, enforce the staffing plans, give nurses the support we need and deserve to provide safe, quality care. Our patients deserve better, and so do we. We deserve better as we show up for them every day. Thank you.
Thank you. Next.
Hi, good afternoon or good evening at this point. My name is Beth Loudon. I'm a neonatal ICU nurse in the cardiac ICU. So we just do the specialized cardiac heart babies. I'm also president of the NYSNA members at New York Presbyterian Columbia. Despite the vital work my colleagues and I do to take care of New Yorkers, at the bargaining table, we've repeatedly seen NYP treat our role as a number on a spreadsheet and thus undervalue the health of our patients. Yesterday, nurses from all over the hospital, from our ED to our PACU to our NICU to our medical oncology unit, testified at our bargaining table to one major theme. Patients are getting sicker, the volume of patients are getting higher, and staffing is remaining stagnant, so therefore short. NYP has cut critical services to serve the rich. They cut our palliative care unit, where patients and their families would be cared for in a supportive, specialized environment to pass peacefully. Now these patients are cared for on busy med-surg floors, where a nurse has 3 other patients with varying needs. They cut our midwifery service at the Allen, specialized NPs to care for sick children, a whole newborn nursery, a pediatric infusion clinic, and slimmed our inpatient rehabilitation unit to bare bones after community outcry. One floor up, NYP is now transitioning back to providing VIP rooms for the rich in place of med-surg beds on our transplant unit. One of the nurses said yesterday, I quote, "There comes a point when we must collectively ask, are we adequately valuing human life?" Amidst healthcare cuts at the federal level, New Yorkers need wealthy hospitals like NYP to step in and protect care. That's why nurses like me are speaking out, because we must hold the richest hospitals in the city accountable. NYP can afford to safely staff. NYP can afford to keep these services that serve the community. If NYP wants to save in this upcoming year, we're calling on them to look at their outrageous executive compensation, which is some of the highest in the country, or to their billion-dollar hedge fund, or in their millions of revenue. They're already in the green, not on our backs. We have been bargaining with NYP since August. Only yesterday did they finally give us responses, non-financial responses, I will say, that do not respond to our demands, but rather take back rights that we already have. So we're here demanding that hospitals invest in safe patient care because we know they can afford to do better. Thank you.
Next. Mm-hmm.
Hello, my name is Sophie Boland. I'm a pediatric ICU nurse at New York Presbyterian. I'm also on the executive committee and negotiating committee at New York Presbyterian. I chose this work because I was hospitalized as a child, so I know what it feels like to go from a healthy child to a vulnerable patient in a hospital. And I wanted to give other children the safety and care that I once needed. I've been a nurse for almost 10 years, and I love what I do. I love the teamwork, the complexity, and the chance to make a real difference in a critically ill child's life and their families' lives as well. However, it's become increasingly difficult to deliver safe patient care at a high level of excellence, particularly when working with not enough staff. Working short staff impedes patient care, but it also contributes to higher incidents of workplace violence perpetrated against nurses who cannot possibly attend to every patient's needs when the caseload is too high. Working short staff contributes to nurse burnout as the hospital capitalizes and profits on the goodwill of nurses who, whatever the circumstances or staffing deficits, will prioritize patient care to their own detriment. The moral burden of coming to work to deliver exceptional patient care and leaving feeling as though you haven't met the patient's needs despite your best efforts. It's why I would say there isn't a nursing shortage, but a shortage of nurses who are unwilling to put up with these conditions. This is why nurses are leaving the bedside. For the past 2.5 years, I've been involved in a staffing arbitration case for one of the highest acuity units of the Children's Hospital, NYP, serving the sickest of the sick children across the city, possibly across the country. This unit sees patients that other facilities countrywide have refused to offer treatment to because their surgeries they need are too risky or require too many resources. In my 5 years on this unit, I experienced pattern and consistent critical levels of short staffing, and today this case still has no resolution. This is how long these delays drag on, and it's not accidental. Our employer has become an expert in kicking the can down the road to avoid any accountability, to keeping patients and nurses safe. Instead of fixing the staffing problems that created the issue in the first place, New York Presbyterian is using its enormous resources to spend an untold amount of money on their lawyers to fight nurses. Meanwhile, the patients we care for are getting sicker. As a major academic medical center, we receive some of the most complex cases in the world. Acuity keeps rising as the hospital invests in new technologies and new interventions, but without investing enough to safely care for those patients. Our employer has said it's too expensive to hire more nurses or that there simply aren't enough nurses in New York City, quote. But just months ago, they laid off 2% of our workforce. It doesn't make any sense. In 2023, over 30 NYP executives made more than $1 million a year in salary, benefits, and perks. We need to hold one of the wealthiest hospitals in the city accountable to deliver the safe patient care they promise in their TV ads and billboards. We're calling on our allies in City Hall to advocate alongside us in a fight for a fair contract with enforceable safe staffing standards. We know the fight will be tough. NYP has money, but we have thousands of nurses fighting for respect and dignity, and it's time to show hospitals like NYP that they need to put patients over profits.
Thank you.
Thank you.
Next
one. Excuse me. Good evening, everyone. My name is Russell Pinsker. I'm a nurse at Maimonides Medical Center in the cardiothoracic ICU, also known as the open heart unit, where I've worked for the past 4 out of 8 years. I'm also the proud son of a nurse who has dedicated 47 years of her life to Maimonides. I was born and raised in Brooklyn, born at Maimonides, and I decided to become a nurse, seeing the dedication my mother had to the hospital and the community it serves. This community is important to me, and as a nurse gives me meaning and purpose in serving it. I'm also on the bargaining committee. This time around, we're bargaining against a totally different group of people, and they've made it clear that they do not share our priorities, which is first and foremost, safe patient care. It has been 6 weeks since our first bargaining session, and we made little progress towards our goal, ensuring the best care for the future of the community. Instead, I've watched management completely disrespect nurses and the care we offer while we demand safe staffing for our patients. People think that because we work for a safety net hospital, we aren't entitled to the same staffing standards, benefits, and wages as the wealthier private hospitals. That's the hospital's message. But I hear it from reporters and others too. Maintaining wages and benefits to help recruit and retain nurses at our safety net hospitals is a question of equality, because quality care should not be determined by your zip code. And nurses deserve the benefits that will take care of us when we retire, as my mother has relied on. However, now the hospital is trying to roll back these gains and the things nurses have worked hard for. At Maimonides, they are trying to take away our retiree health care, which would create unnecessary hardships on our families and our healthcare system at the time that healthcare costs are becoming more unaffordable. My mother relies on her retiree health benefits to cover medical expenses, and it's something many of us have dedicated our careers to this hospital have looked forward to. We need Maimonides to step up and respect the nurses by protecting our benefits. Nurses spend their entire careers dedicating their lives, caring for others. They deserve to retire knowing that they are also going to be cared for.
Thank you. One of the questions that I have quickly went over my head. We talk about it, reinforcement. I think that was $11.99. What's your vision about the reinforcement that we as council can take?
The staffing legislation enforcement.
Yeah.
Is that the staffing legislation did not give guidelines of what enforcement would look like. So for us, enforcement will be either penalizing their hospitals when they fail to meet the minimum staffing guidelines that they submit to DOH, and DOH making them accountable. We have an unsurmountable amount of complaints, and I'm sure I'm not the only institution that have these complaints that have not been addressed. We submit them to DOH, but they just sit there.
Okay. I'll work on it. Somebody else has to? Okay.
And then the development of the staffing plans to begin with. We do have our staffing guidelines in our contract, and they have to be deferential to that. There are our 1199 brothers and sisters in our hospital don't have those in their contracts, so the hospital just got to make up what they wanted in the units. We put forth with the whole union side what we want and what would be safe, and then the CEO just gets to decide. So there's no really like bargaining at that point. It's just what the CEO wants.
Okay. That's something that I'm gonna process and see how the best we can approach that. The staffing is more like we passed the razor here, but it's more state. But we will look into it and talk to our colleagues on the state level to see what else that we can do to move them to the right direction instead of the CEOs, and all the O's that get in the most of the money. So we'll look into that. And do we have online people? Okay. So I'm going to say thank you. Thank you for being here, and thank you taking your mother 47 years, adding to yours. That's a lot of years, because in military we do that. So in nursing we can do that too. Okay, yeah, I will get to it. So so all the years, thank you for your commitment from your family to the next generation, still doing it. And I'm hoping that we can keep nursing in the state, that your kids or your family keep on coming to nursing. So thank you, everyone. Thank you for your hard work, Madam President, and continue organizing. And then we are here in the council, hear you out. We're your friends, we're your partners. And then one of the things that my colleagues always said, they can forget everything about me, but they would never forget that I'm a nurse, because every second, even the sergeant can tell you. So thank you. Thank you so much for your time.
Thank you.
Okay. Okay.
I think we should call her name one more time just to be certain.
All right. Deidre is still not here, right? She's not here? She got to go. All right. So I just want to make sure that we cover all the bases. If you were in the room that you wanted to testify, this is the time. This is your last chance. Please see the sergeant. Everybody satisfied? No one else? That's good. So thank you to all of you who came here to share your thoughts and experiences today. If there is anyone in the chamber, like I said, this is your last chance, who wish to speak but has not yet had the opportunity to do so, please raise your hand or fill out an appearance card with the Sergeant at Arms, and at the back of the room you will find one. There's one here. Seeing none? Seeing no hands in the chamber, we'll now shift to the Zoom testimony. When your name is called, please wait until the member of our team unmute you and the Sergeant at Arms indicate that you may begin. We'll start with, let me see the names. Nkechi Odeoso.
You may begin.
All right, no Nkechi. Ann Goldman. Ann Goldman. No. Alex Stein. All right. Okay. We are making a final call for the Zoom registrant who have not yet spoken. Anyone on the Zoom, it is time to raise your hand. If you are currently on the Zoom and wish to speak, but have not yet had the opportunity to do so, please use the raise hand function and our staff will unmute you. Seeing no hands, I would like to note that everyone can submit written testimony to testimony@council.nyc.gov within 72 hours of this hearing. To conclude, I want to say thank you to everyone. Thank you to, of course, Joshua Newman, of course, Aria Ogazawara, and all the staff that make it possible for today. And of course, Courtney Lee, that stay with me, my fellow, and Frank Shea, and Drashina Jilo. And of course, my sergeant and all the technicians. Thank you for your collaboration. Now, our hearing adjourned.